Good morning and welcome to the 21st meeting of the Health, Social Care and Sport Committee in 2025. I've received no apologies for today's meeting. The first item on our agenda is for the committee to agree to take items 4 and 5 in private. Are members agreed? The next item on our agenda is to take oral evidence on a further supplementary legislative consent memorandum on the Employment Rights Bill. The purpose of the Employment Rights Bill is to deliver the key legislative reforms set out in the UK Government's plan to make work pay. The Bill's explanatory note states its purpose is to update and enhance existing employment rights and make provision for new rights, make provision regarding pay and conditions in particular sectors, make reforms in relation to trade union matters and industrial action, and to create a new regime for the enforcement of employment law. This committee previously took evidence on an earlier supplementary LCM on the Employment Rights Bill in May this year, and it published a report on that previous supplementary LCM on the 10th of June. The further supplementary LCM S653B, currently under consideration, was lodged in the Scottish Parliament on the 14th of August. It recommends legislative consent with respect to amendments to clauses 44 to 46 and 49 of the bill that were tabled on the 7th of July. And I welcome to the committee Tom Arthur, Minister for Social Care and Mental Wellbeing, Anne Cairns, Solicitor, Danny Duffy, Fair Work Social Care, David Holmes, Fair Work Economy, and Rachel Thomas, Fair Work Social Care, Scottish Government. And I invite the Minister to make an opening statement.
Thank you, Convener, and good morning to you and to the rest of the committee. This supplementary LCM should be read in conjunction with the Scottish Government's previous memoranda on the Employment Rights Bill, dated 11th December 2024 and 3rd April 2025. The Scottish Government has been working closely with care providers, trade unions, local government and regulators for a number of years to deliver fair work in the social care sector. But as you are aware, the Scottish Government's ability to act in this area is constrained by the devolution settlement. Nevertheless, we have continued to deliver what we can using the powers available to us, including enabling payment of a real living wage to all social care workers, delivering direct care and commission services, developing an effective voice framework for the sector, which is nearing conclusion of a pilot phase, and working with the sector to identify priority areas for enhanced terms and conditions in due course. However, the Employment Rights Bill and subsequent amendments now confer some limited powers on the Scottish Ministers, and it is for these reasons that a supplementary LCM is required for these provisions. Now, a lot of work has also been carried out to develop and design a process for delivering a voluntary sectoral bargaining model for Scotland as well, which I think is important to note. When the Employment Rights Bill was first introduced, it included provisions relating to the social care sector in England, most notably for the establishment of a negotiating body through regulations to consider pay, terms and conditions for the adult social care sector in England. The outcome of those negotiations, once accepted by the Secretary of State, were also to be enacted through regulations delivering fair pay agreements for those workers in scope. The Scottish Government recognised the opportunity to potentially underpin much of the work already undertaken in Scotland on sectoral bargaining by seeking to have the scope of that bill extended to Scotland. This will provide the Scottish Government with the option to regulate for negotiated fair pay agreements for the sector as an alternative to the aforementioned voluntary process. We've also succeeded in securing broader applications of these Bill's provisions to children's services, not just adults, and we look forward to continuing to work closely with the UK Government to build on our fair work principles and help maximise the positive impact of the Employment Rights Bill across Scotland. The amendments that this LCM pertains to clarify that negotiating bodies can only set minimum terms and conditions of employment for social care workers, cannot adversely affect those workers' existing terms and conditions, or prevent employers from offering better terms and conditions than those agreed by the negotiating body. And they also establish the parliamentary procedure for approving codes and guidance. Together, these measures protect social care workers from being forced onto worse contracts, safeguard fair pay and conditions, and help maintain a competitive and sustainable workforce across the sector. Thank you.
Thank you, Minister, for that very comprehensive statement. I've had no indication from any members that they have any further questions. I think the committee has already scrutinised this, several LCMs previously on this issue, and I'll now briefly suspend the meeting to allow for a changeover of witnesses. The next item on our agenda is to take oral evidence on the proposed National Good Food Nation Plan that was published by the Scottish Government on the 27th of June. I welcome to the committee Vary Brown, Head of Food Futures, Food, Farming and Countryside Commission Scotland, Anna Chowrow, Deputy Director of Nourish Scotland, representing the Scottish Food Coalition, Claire Hislop, Organisational Lead for Food and Physical Activity, Public Health Scotland, and Professor Lindsay Jacks, Deputy Director and Personal Chair of Global Health and Nutrition, University of Edinburgh. And we will move straight to questions. And Carol Morgan.
Thank you very much, Convener, and thank you very much to the panel for coming along. We look forward to your evidence. I want to start really quite generally and just talk a wee bit about the plan overall. I think it's fair to say it's ambitious, but it's also fair to say it's been ongoing for many years. We need to move into an action stage. We've talked about it enough. So I would really like your views on, can we achieve the outcomes and the vision that we've talked about over the last 10 years? And I'm particularly keen to know how we get that hurdle of that sort of cross-portfolio working. We know that we've got to do this with this plan, and I wonder if you have some view of how we can move that forward. And, the size of the Scottish Government are the things that we need to do to make sure this happens. And I'm happy to just go. Lindsay, you seem to be nodding.
Yeah. Is this on?
It'll work, Ottoman.
Oh, okay. I'll let my colleagues speak a bit more, particularly Claire, about the cross-sector working. But in terms of can we achieve it, I think, you can achieve anything. It is ambitious, but absolutely. And there's precedent for this globally, where you see big shifts in what people are eating. Often it goes in the less healthy direction, but there's no reason to believe that it can't go in a healthy and sustainable direction. So I would say absolutely. But can we achieve it with the policies that are outlined in the existing plan? I would say probably not. It's not sufficient what we're currently doing, which is what the current plan outlines. But I do think that this is the first plan of many to come, and it's worthwhile to get going, get started, monitor and evaluate what's working and share those lessons. But yeah, I think it can be achieved. We need to do more to achieve it, but that doesn't mean we shouldn't get started.
Thank you.
Thank you for inviting us here today. I think for Public Health Scotland, improving diet in a healthy way is a kind of core part of what we do within Scotland, and I think collaboration is a key point here. I think we really welcome the Good Food Nation and the opportunity that it brings to work collaboratively across the sector. I think it really sets out how we're going to work with a cross-government support around this and looking at different policies. I think it does need to more engage how we're going to get other stakeholders involved in this. This is going to take a whole system approach, and so we need other actors within the system to work around this. So I think obviously we need to kind of outline how we do that better. But working on improving health has never been more important, and I think it not only improves our health and our well-being across the sector, but also it helps build our economy. We have a healthier workforce. We're going to reduce obviously our input to NHS. We really need to move away from that kind of individual behaviour change. So I think in terms of what the plan gives us an opportunity is to work much more collaboratively across the system. I think we've had a recent publication of our population health framework, which is a momentous occasion for kind of public health that sets out a 10-year plan for what we need to do. I think working that collectively, we have an opportunity here to make change. We've not seen change in the past that we need. I can't sit comfortably here and say to you that if you're a child on P1, you're twice as likely to be at risk of overweight and obesity than if you are in our wealthiest communities compared to our lowest communities. We need to take action. And I think with this, the population health framework and other policies around Scotland, this is our opportunity to work together, not just in government, but across stakeholders within our NHS, our local authorities, our third sector, our businesses, to kind of come together to take this action. So I think we can do it. I think it's not going to happen overnight. But I think that's why we're all here around this table, to kind of make this happen.
Thank you. Mary.
Yes, good morning. Thank you very much for the invite to speak to the committee today. Yes, I think at the Food Farming and Countryside Commission we really do welcome kind of this food systems approach, and there is a lot in the plan that is very positive. What I would say is that there is a real imbalance of power in the food system. There's a real concentration of power with corporate influence. So multinational corporations have the resource and the access to policy to really influence not just what we're eating, what's on supermarket shelves, how that is produced and distributed, but they also have access into policy as well, and that can lead to dilution of policies, confusion about evidence, and a tendency to go to voluntary measures as opposed to mandatory. And so, although there is a lot of great language in the plan around changing the food environment, which we very much support, without addressing that corporate power explicitly and having clear indicators that could help address that corporate power, I feel that the leadership that has been shown by Scottish Government, it could be undermined in delivering the plan and the impact.
Thank you. Anna?
Yes, I absolutely agree with you. The plan is very ambitious in scope in terms of the sort of longer term outcomes that it talks about. So the direction of travel is absolutely right, but I think to echo Lindsay's point, it is at the moment mostly a summary of existing policies, and the existing policies will not allow us to move in the direction that we're outlining at the pace at which we need to do that. And collaboration, I agree with Claire, is absolutely key across. It's not just a whole government effort, it's a whole kind of society, national endeavour, really. And so outlining clear mechanisms for collaboration between local authorities, health boards, civil society, community groups, businesses, but also the new Independent Food Commission is really key, and it's not yet been evident either in the plan or really in how we've developed the proposed plan thus far, that collaboration is really kind of at the forefront of the mind. I think what is interesting is to look at some of the guidance that is coming out from FAO most recently about implementing food system approaches, because we talk a lot about food system approaches as being something we need to do more of, but the actual implementation is quite difficult. And what they talk about is the importance of distributed leadership, allowing people to work beyond their mandates to really look at opportunities for collaboration where there's intersection of different aspects of the plan or policies. I think the plan as it stands is still quite siloed in its approach. There's not yet been enough collaboration across government, I think, and across domains. So there is opportunities definitely to do more.
Thank you. I mean, I think my colleagues are going to discuss some of this. I won't focus too much, but Anna, if there was sort of one message to give to government in terms of cross-portfolio working, what do you think it would be? Do they just need to talk more, or do we need to have an action plan, or what advice would you give us? Because we talk about this cross-portfolio working so much, but just getting it in place seems quite difficult at times.
Yes, so I think if it was an easy question, we would have solved it by now, I think. And it's always good to, I think, extend a little bit of grace to people who are trying really hard, I think, to try new ways of working in government, which is not easy. I think more use of the ministerial working group on food is right. I think also bringing more stakeholders around the table in the form of roundtables, steering groups, to allow a kind of wider perspective on the food system, which, not only is vast and complex, but also is very dynamic in nature, so things change all the time. And so continuing to bring people around the table to offer different perspectives, and for government to weigh up the views and evidence they're hearing, and to be really clear in the kind of direction of travel is what's needed.
Lindsay, I wonder if I could just ask one question more just about that sort of leadership. In terms of leadership, do you think that comes from government, and they then have to pass that to other stakeholders to do that much more working beyond scope type activity?
Yeah, I think that makes a lot of sense, but I also think there needs to be, as Anna's mentioned, this distributed leadership. So champions are actually really effective for getting movements going in terms of food system transformation. But the issue there is sort of the legacy when what happens once those champions move away. And so you see that happen whether it's at a local authority level or up at a national level, or at an institutional level when it comes to institutional food. And so I think leadership and these champions are important, but there also needs to be systems in place to ensure that there's continuity should those champions move on to something else. And so I think that's where these sort of networks where local authorities, health boards and others can learn from each other around what's working is really valuable. And we've heard asks actually to the Living Lab for these types of platforms and sharing spaces where people who are responsible for developing these plans can come together and share what has worked, what hasn't worked, and how they're going about things, so that there's not sort of a duplication of effort across the different authorities that are responsible for making plans. So I think there does need to be leadership at multiple levels, and it needs to kind of go iteratively with some leadership coming from the national government, but also leadership from local authorities and health boards going up in a reciprocal way.
Okay, lovely. Thanks, Convener.
Emma Harper.
Thank you. Thanks, Convener. Loads of questions going through my head, but I'll stick with just what you're saying about local authorities and then health boards. And each local authority and each health board has to come up with a plan, and then that has to kind of reflect on what the Good Food Nation plan by the government is proposing. What if there's conflict between a local authority's plan in terms of land use strategy, all of these things that we're looking at in terms of building houses on greenfield sites, for instance, and then a health board's plan might be more focused on health rather than land use. So how would we not have conflict if we're trying to help support changes to our food system locally, and then I'll stick with local instead of going global. Anna's nodding.
I think it's a really important question, and kind of emphasising the importance of collaboration, but also emphasising the importance of being able to deal with power dynamics in the system, and conflict management is also one of the things the FAO is increasingly pointing to as a skill that is needed to be able to advance food systems change. We've been very pleased to see guidance come out of the Scottish Government that says health boards and local authorities are able to collaborate on the plans, because the last thing we want is that kind of, as you say, clash of outcomes. The other thing I think that would have been helpful was more collaboration at earlier stages with local authorities, some of which already have food plans in place, like Glasgow and Fife, to learn from those examples and to have not so much national policies kind of cascading down to local authorities, but more of a dialogue there to understand where there might be potential pressure points. Yeah, I think I'll probably pause there.
Does the Food Commission need to help support, like providing a template for each local authority and each health board to follow, so that helps give guidance, actually?
I think what is at the moment quite confusing in the plan is that it both says local authorities need to have regard to the outcomes that are specified in the national plan, but at the same time can come up with their own outcomes and their own priorities. And that is, I think, a kind of contradictory guidance that isn't helpful. So I think whether it's a Food Commission, whether it's a dialogue between Scottish Government and COSLA or wider local authorities and health boards, I think there needs to be more collaboration there for sure.
Okay, thanks. Thank you.
David Torrance.
Thank you, Convener. Good morning to the witnesses. Can the witnesses explain how a population health framework and the proposed Good Food Nation plan will ensure an improvement in food environment? And Anyone, ladies?
Yeah, so obviously we have our Good Food Nation plan, and now we have our new population health framework. That clearly sets out the ambition of improving diet and healthy weight as a key priority for the next few years. The Scottish Government, working alongside ourselves, Food Standards Scotland and others, will be producing a diet and healthy weight implementation plan to take forward some of the actions that are required. The importance of those actions is that they are evidence-based and can be implementable across Scotland. So we're working on that to see how we kind of achieve the both. When we do that, we will be giving consideration to the actions that are outlined within the Good Food Nation plan, because ultimately our health boards and our local authorities and stakeholders will be delivering on both of these policies. So therefore, we need to make sure that these marry up to enable that to happen. We do need to see a significant change in our food environment. You know, talked earlier about individual responsibility, and I think there's still a societal belief that, you know, that old rhetoric, we just need to eat less and move more, and that's not the case. We can't do that when you go out into an environment where you're surrounded by sweets piled high at checkouts, or, you know, offered a bar of chocolate when you go to buy your newspaper. We need to change that dynamic. We've got an opportunity here through working collaboratively through the Good Food Nation plan, working cross-policy sectors, so we can work with the likes of economic policy, climate change, bringing these all together to really make that difference. Working through that with the population health framework and our new implementation plan to hopefully make the difference that we need to see, so that we're not having to spoke some of the figures that I said earlier. Because we do know that our projections from our future burden disease studies show that, for example, this is going to get worse. Our obesity is going to rise. We will potentially see a 36% increase with type 2 diabetes by 2044 if we don't stop this. We need to make this happen now. We have tools now, legislative tools, to make this happen. So hopefully they will work together to enable this to happen.
Thank you. To what extent do a plan and population health framework properly and explicitly consider obesity and poor diet in relation to a range of demographics? For example, the elderly, those who are malnourished, ethnic minorities, and those with disordered eating.
Coming on that again as well. The population health framework does outline that it wants to take a health in all policies approach, which means that all policies which are linked to having an implication for health, we'd want to consider what impact. So we have suggested, and we've also suggested this in our consultation response to the Good Food Nation, that we take a health and all policies approach and use health inequalities impact assessments when we're actually developing policy. Health inequalities impact assessment take into consideration the wider building blocks of health, but also the different population groups. So if we were to use them as a tool, it would ensure that policy development takes into account of the kind of broad spectrum of ranges, like, for example, elderly populations and you know, different cultural aspects as well.
Anna?
If I can add to that, I think there is a lot of focus these days in all of the policies to talk about healthy weight, meaning recognising, as you pointed out, that there's also questions of kind of malnutrition and eating disorders. I think in practice, when we hear it, we still think about overweight and obesity, so we're not considering those other ends of the spectrum sufficiently, particularly malnutrition in older age groups, where we're actually probably more concerned with people eating enough rather than eating too much. But I also think you've mentioned kind of demographics and different income brackets. There is definitely health inequalities issues and dietary health inequalities issues when it comes to people's incomes. At the same time, if 20% of people living in the most affluent areas are still struggle with obesity, that means that we have a really wide societal problem with this issue. So, you know, yes, there is some discrepancies, but actually it's a much more broader issue that needs, I think, really bold action, to echo Claire's point.
Thank you. Submissions to our call for views highlighted the importance of food procurement in the public sector for school meals, hospital, care sector, but procurement is not discussed in the framework in relation to community wealth building. To what extent are public procurement practices for food, for children, patients and vulnerable people in care important to public health? And why is this not addressed in the population health framework?
Maybe just comment on the first part, but I maybe will leave the second part to Claire. But in terms of impacts of procurement, I might speak specifically to school meals. So we've been running a national dietary assessment of children and young people in Scotland on behalf of Food Standards Scotland at the university. And we've been recently looking at the children who consume school meals, and we find that they're much more likely to achieve the Scottish dietary goals than children who don't. And one of the other interesting things we see in that data is that around the age of between 7 and 10, diets start to, that's when you start to see diets deteriorate in terms of heading towards more unhealthy foods, whether that's looking at fiber intake or micronutrient intake like iron, or if you're looking at ultra-processed food consumption. And that suggests that some of the benefits of universal school meals early in primary school are being realized now when you look at national dietary surveys. 2 to 4-year-olds in Scotland have the healthiest diets of any population group that we've looked at in all of the national diet data. So I think that suggests that public procurement, particularly for diets of children and young people, can play a very significant role. And one can hope that we will reap the long-term benefits of those children having healthy diets at an early age. I think a lot of work needs to be done for secondary school students, because that's where we see the least healthy diets, and also particularly in adolescent girls, we see the highest risk of micronutrient insufficiency. So I think there's lots that can be done, and we were very much in support of the other responses that were submitted that were saying that extension of universal school meals to all of primary school students and secondary school should be explored, because that could have a very significant impact on long-term trajectories for healthy diets.
Claire?
So, I mean, public sector procurement has a key role, as well as setting an example, you know, to the wider sector, but also delivering healthy meals, healthy, potentially locally sustained meals to our public sector. In terms of community wealth building, it's an opportunity to kind of develop our local economy as well. So there's a real key opportunity here to provide thousands of healthier, more sustainable, locally sourced meals to people within the public sector, within our nurseries, our hospitals and our care homes. I think the opportunity there for working locally through procurement, and I know there is examples across Scotland who are now actually doing that. I think Fife are looking at how they can build it in their community wealth building, and using the kind of anchor institutions as a way forward to procure public meals. I think what we do need to recognise is this is a really, really important factor. But as Lindsay said, you know, once they leave these buildings, we've got a food environment that doesn't necessarily support what we're educating in the public sector building. So we've still got a role to do both. But I think there's certainly a role for public sector procurement within providing healthier, more sustainable meals for people.
Thank you, Claire.
Hein Whittle.
Thank you. Good morning. Thank you for being here. I've got a long-standing interest in this particular topic. And I was just listening about the public procurement thing, and we have a situation here where for years I've been talking about the fact that we, in our hospitals, and big hospitals in Glasgow and Edinburgh, we don't have kitchens, so there's no ability to cook any food that was procured locally. And currently we drive it up the M6 already packaged from Wales, and most of it's thrown out. So when we're talking about Good Food Nation Bill, and we're talking in glowing terms about this wide-ranging plan from the Scottish Government against that environment, how do those two, how do we square that circle? If we've got no ability in a hospital to cook food, as I said, we're buying it from Wales already packaged, bringing it up, reheating it, and then throwing it out. How do you square that circle? Anybody?
I'm happy to begin. think we generally in Britain and also in Scotland have a very industrialised food system, as you point to, more so than in other cultures, and that's just one of the examples of that. And I think if we think about the Good Food Nation ambition, we have to think about what is the food culture that we're striving to have in Scotland, what are the values around food that we want to cultivate, and how the investments that we make follow those values. I think we still, in general, underestimate the importance of food systems transformation in general, and food experiences, as you've pointed to in particular, but also kind of wider questions of how important food system transformation is and the investment in that food systems transformation. The UN says that that particular area is one of 6 key entry points for achieving wider sustainable development goals, because any changes you make to the food systems cascade across a wide area, a wide range of kind of social policies and environmental policies. So I think for the government to follow through on the boldness of the outcomes of the plan and to make real investment in bringing kitchens back, training the staff to cook with raw ingredients, working with organic produce and procurement, all of that is really important in kind of modelling from the government end the kind of food system we want to see.
We really do need to acknowledge that we are very much in a globalised food system at the moment, and the real positive of the plan is that it is talking about place-based approaches and much more local leadership. But with that, we need to really recognise what's needed to support local food systems, including investment in infrastructure, to make sure that local producers have a route to market. We talk a lot in the plan about, food accessibility, and the reality for so many people across Scotland in rural areas, really remote areas, is that they would have to travel miles to get to, even a supermarket. We need to invest in things like food hubs that really ensure that people can access the food that is grown probably in the fields right next door that they can't then access. And I think that's a big barrier to public procurement then. There's many barriers for local producers getting into procurement, but it really tends to go to these kind of large contracts, to volume over quality, over where it's produced. And so I truly believe in the power of public procurement. Public food can be a real good for the country, but we really need to be honest about what's needed to get to that point.
Thank you. Patrick Harvey.
Thank you very much, Convener. It kind of leads quite well on from that. I was going to talk about food education, and a lot of that is schools, but not exclusively schools, of course. Can you, just at the highest level, tell me whether you think there's enough ambition in the plan around food education, including cooking skills, but education in that broader sense about the relationship that we have with food, whether in the curriculum or in the wider sense of where education comes from.
I think that the plan actually emphasizes education and cooking too much. Yes, so educating kids and people about food puts the onus of change on individuals. Mm-hmm. The food environment needs to change. It needs to be convenient. It needs to be the default option to eat a healthy and sustainable diet. And it does not need to be up to consumers to know what is healthy and sustainable and choose that thing and afford that thing. It needs to be the default. Take a place like France. So if you look at, for example, the number of hours people in France cook a week, it's actually less than the number of hours people cook in the UK each week. 5.5 hours in France and 5.9 in the UK. So I don't think that cooking actually is necessary to have a healthy and sustainable diet. In fact, if you're cooking with gas, it may be less sustainable to cook at home, certainly to cook a loaf of bread at home versus to purchase it from a local bakery. So I think that actually the plan needs to de-emphasize educating individuals and really crank up the emphasis on making a healthy, sustainable diet affordable and convenient for everyone in Scotland. So that's my view, and maybe Anna, you want to add to that?
Yeah, happily. I think I absolutely agree with you. I think sometimes we focus so much on the conversation about educating the children in particular and education more broadly, really as a way of kind of avoiding other conversations, more difficult conversations. So it's a bit of a red herring when we need to be talking about, as you've mentioned, power dynamics in the system, trade-offs, etc., and the wider food environment. There's really interesting research about people's food literacy and confidence in being able to cook at home. It's really high, it's over 90%. So education isn't really the thing we need to be focusing on. I think maybe the last thing to add on that point is I had a really interesting experience talking to young kids in one of the primary schools in Edinburgh about in preparation to the Good Food Nation conversation. So we just went in and said, what do you know about food? And they told us, my mum gets lots of coupons through the door for takeaway meals and pizzas, and that's not very healthy. They said, of course, those fast food workers, they don't care how much salt they put on your food because they're not paid very much and the job isn't very secure, so why would they care? They said to us, free-range chickens and really free-range. So actually the level of awareness in younger population, and I think population at large, is really, really high. And absolutely agree with you. We need to focus on the environment we live in as opposed to individual behaviour.
I find this really interesting. Maybe in the framing of the question, I didn't quite express the sense that food education is something broader than just cooking skills. It's not as simple as that. I was thinking back to one of the earliest bills that I had to deal with scrutiny in this Parliament nearly 20 years ago. We're aware that the kind of Good Food Nation ethos is 10 years old and the attempt to get that. Nearly 20 years ago, we had a piece of legislation going through on schools' public health and nutrition. And I took the view at the time that it was quite reductive in its approach to nutritional standards, albeit that may have been progress at the time in many senses. But even then, some of the best schools were doing that, but going way beyond it. They were creating a food environment which, in terms of where children were eating, it felt like a group of human beings sitting around a table sharing food together, whereas other schools were creating a food environment that looked like a fast food outlet. And that in itself is part of food education, isn't it? The kind of, I think we still see a lot of schools where the food is consumed in an environment that looks like a fast food outlet with disposable packaging on everything and so on. Whereas 20 years ago, some of the best local authorities were doing something completely different, and they were thinking about food culture as part of their educational role. So when I talk about food education, I'm not just talking about teaching people how to cook, but what is our education system really teaching about how we consume, how we eat together?
If I can briefly respond to that in that case, I think food culture is profoundly important in all of this and kind of underestimated. And you can see how it kind of lives out in schools in these different ways, but also I think beyond the school environment, some of the community settings are doing incredible work at fostering really vibrant food cultures through community growing, celebration of food, food festivals, harvest festivals, etc. Those efforts deserve, the credit and the support to grow a better food culture. And maybe to add to that is also that we tend to, I think, focus the education on sort of genuine nutrition, but actually vocational skills in terms of training up chefs and cooks to bring forward more plant-forward diets, celebration of food, local sourcing. All of these things are really important.
So if I can reframe the original question then, is the plan ambitious enough at achieving that kind of transformation in in how we educate ourselves and how we create a culture around food that captures the spirit of what you're talking about, which, as I said, was being done in some places 20 years ago, is still being done in some places, but is far from being the norm. Is the plan going to deliver that kind of change? I don't know if anybody else hasn't spoken wants to.
Maybe if I could come in. I think, yes, thank you for reframing that. I think what could be more explicit in the plan is the current situation where we are now, and the culture of convenience that we have now that has been created over many years of a really industrialised food system, and painting a picture, not just a vision, but a version of where we could get to. With that, all of the really necessary legislative work and really, robust policies will play a great part towards getting there. I think that change in the food culture, it's almost, it's quite field of dreams. If you build it, they will come. If the healthier food is there, the local food is there, people can access food wherever they go, the culture will naturally change as a result of that.
If there are no other comments on what I've already asked.
I was going to come in around, we mentioned kind of our third sector around this, and I think we have got an absolutely thriving third sector working around food, and not just in growing, but community skills, community cafes. They have such a key role in this to help deliver that food culture, but they also tackle so many other issues that we need to address through the Good Food Nation plan. They allow us access to communities that we might not get in other ways through food, and using that as a medium to do things like discuss things like income maximisation or offer training. So I think we've got a real asset within our third communities, and maybe within our plan we do need to strengthen the role of the third sector and the kind of community food work across that to help strengthen in that, and the raft of opportunities they bring to improving health.
The last question on food education, really, in the broadest sense, is about staff. Whether that's school staff, whether that's staff in hospitals, care settings, other parts of the public sector. Food education is also about creating that, not just basic skills, but that approach to a different kind of food culture that we're trying to create within the staff in these organisations. So how does the plan engage with and expect an empowering and a respectful approach to changing what we expect from people working in food in those kind of environments?
I mean, I'm happy to come in. I've worked over the years on a lot of the kind of public sector guidance around food. So I've worked on school food, nursery food, working on the kind of hospital food. And I think always a key component about that is the staff and how that is delivered. I, in a previous role, was a school inspector, and you did, when you went into a school dining room and the staff were very, very engaged about talking to the children about food, that was a real buzz about that. I think when we're delivering a lot of these kind of policies, training is built in for staff. I mean, I'm not saying it's always going to be perfect, but I think that does have a key role in enabling the change we need to see happen. So I think through various parts of the ambitions of the plan, the striving for kind of training and delivery on that will be really, really important.
Anyone else? Okay, thank you very much.
Sanders Gohan.
Thank you, and a declaration of interest as a practising NHS GP. Just listening to what's been said so far, what I'm hearing is it's not down to individuals. It's the way that food looks within a store. I'm hearing that we don't need people to cook, because the answer that we got from Patrick Harvey, you gave to Patrick Harvey, was not about educating people on how to cook, but actually, from the sounds of it, getting ready meals to be better. I mean, and we talked a lot about the cost of food. Let's just look at Aldi. You can buy carrots for 42 pence, a baking potato for 24 pence. You've got lettuce and Swedes available for 60 odd pence. And we can look at Lidl as well, where we can see the foods that they're offering. You can buy a 10 pork loin for £6.49. You know, these are affordable prices that allow people to cook in a very healthy way for their family on a budget. But am I actually hearing that that's not what we need to do?
So, if it's all right, I might chime in. So I'm not saying that people shouldn't cook, but I'm saying that people learning how to cook or more cooking lessons is not going to be the answer. So it's not just the anecdotal thing I said about France, but there have been trials where cooking lessons have been given and they have very little impact on dietary intake in children or their families. So I think that, and as Anna pointed out, I think people know how to cook sufficiently. And the ingredients, as you say, are affordable, but you can't just look at the ingredients. It's also the cost of energy to cook and also the time cost associated with cooking. So if you're coming home and trying to cook a meal in 15 minutes, it's quite difficult, actually. I mean, it's hard to roast carrots in 15 minutes. And so I think it's a question, when we talk about the cost of a cooked meal versus a ready meal in our research, we always include the cost of the people's time in terms of planning, procurement, and cooking and cleanup. And so I think convenience, unfortunately, or I actually don't personally feel, unfortunately, I think convenience is here to stay. In all of the surveys that are done of drivers of food choice in the UK context, convenience is a major driver. It's often second after affordability. And so I don't think that convenient food is going away. Whether convenient food is a ready meal or it's popping into a local community diner and having food with your neighbors, you know, these things could both be considered convenient, but they have very different food cultures underlying them. They could potentially have very different health and sustainability implications. So I think convenience needs to stay in the food system. That's what consumers want. But what is convenient, I think, is open to interpretation. It doesn't have to be an ultra-processed ready meal.
So BBC Good Food have 37 15-minute recipes just there for people to use. We've got slow cookers, which use very little energy, and you can create very healthy meals when you're not even there.
Yeah.
Surely this is the type of thing we need to be promoting.
Yeah, I wouldn't not promote those things, certainly. Yeah.
Okay.
Can I add to that, though? That I think what those 15-minute recipes assume is that somebody in the family or in the household has had the time to plan, shop for, prepare the meal, you know, all of the work that happens before you actually get to the cooking stage, which takes 15 minutes. That burden falls on somebody within the household. It often falls on women. And in households where increasingly both parents work, they're juggling shift work with care work. These things are just difficult. And I think if that strategy of encouraging people to cook more was successful, we would have seen some results of it by now. And we're just not seeing results in the food system. So simply trying the same strategy over and over again, I don't think is going to help us. I think it indicates, you know, some of the food systems thinkers describe it as imaginative gridlock. We're just trying the same strategy over and over again, hoping that it will give us a different result when it won't. And to Lindsay's point about community diners, I think that's how some of other countries are dealing with that problem, or just that simple question that people are seeking convenience in busy and complicated lives through rolling out chains of state-supported restaurants, public diners, public restaurants. And we see those examples in Turkey, Poland, China, Brazil and Mexico, where governments are taking more imaginative approach and bolder approach to kind of trying to both reshape the food culture, reshape the food environment, but not work against the fact that people are seeking, yes, convenience or are trying to manage competing demands. And within those competing demands, cooking is often the things that falls off the agenda. That's just what happens.
Okay. Indian chickpeas with poached eggs, prep time 5 minutes, cook time 10 minutes. Lindsay, I want to, Claire, can I turn to hospitals? BBC survey in 2017 said there was a cost of 94 pence per meal per patient. How are we getting good, healthy meals for that cost?
So we currently have guidance for nutritional standards within food in hospitals, and we have just recently updated these, and they'll be going out soon to be updated. So, I mean, I don't work with hospitals in terms of the board, so I can't give an understanding of how they do, but they have a set of standards that they meet, which hospitals in Scotland are meeting, which have a requirement for nutritional standards, and making sure that there's an offer for a range of different conditions as well, and it is done within budget. I suppose it'll be the same for how school food, and other public sector food is all kind of based on cost. I can't comment on how they are achieving their budgets within that at the moment.
Have you eaten a hospital meal?
Yes.
Was it tasty and good and something that you would happily have again?
I haven't had a problem with any public sector meal I've had recently, so no, I would eat it again, yeah.
I think a lot of people would disagree. Having worked in the hospital sector, we used to joke as workers that if you're smelling the food and you're hungry, something's really wrong. When we're looking at the nutritional intake, if you look at army people who go into hospitals, they're on double portions simply to try to pull up the calorific intake, because people in hospital need a huge amount of calories to recover because they're burning through it. Again, is that something that this plan is going to address?
So there is clear guidance for hospitals called Food in Hospitals Guidance, which outlines standards for different ailments. I mean, it depends what you're in hospital for, whether or not you need to eat specific diets. And obviously that would be down to working with the clinician and the patient, depending on what they're required. So the set of standards allow for that. And obviously you would work with an individual clinician in hospitals. So, I'm confident that what we deliver in hospitals in Scotland, which fulfils the guidance, meets the current nutrition evidence behind it.
And my last question, you spoke about locally sourced ingredients. So will this plan be supporting things like venison, which are actually really healthy ways of eating? And will it also be supporting abattoirs to actually be able to provide Scottish meat to Scottish people?
I can't answer that question. I don't know if any of the others on the panel can.
Happy to briefly speak to it. I think the reference to the National Natural Environment Bill, which is currently being discussed, supports the work on venison, absolutely. As to the question of abattoirs and generally local processing infrastructure, it's an area that we have been talking about as being one of the issues that needs to be solved. And no, not a sufficient amount of attention is being paid to it in the plan. But then that's partly because it's a summary of current policies. So that is precisely, I think, is what we're saying, is we need new areas of policy development and commitment and investment, which this plan isn't making.
Thank you.
I have 5 committee members who want to come in on supplementaries on this, so can I ask that they be short and sharp, and perhaps that the panel could similarly answer quickly. Emma Harper.
Thanks, Convener. Yes, a quick supplementary. I will come to ultra-high processed food. I'm thinking about the work of Henry Dimbleby, talking about reformulation for the foods that we're buying. So reduce the salt, reduce the fat, reduce the sugar. And thinking also about Pekka Puska and what they did in Finland as a population health strategy to add mushrooms to sausages, and that was working with the processors. So, the whole system is complicated, and there is things that can be done. So, is reformulation part of the plan that needs to be taken forward to help support less high-fat, sugar and salt?
I can maybe comment on this briefly. I think we need to throw everything we can at it. So I think certainly in the short term, reformulation should definitely be part of the plan. I think ultra-processed foods, there is a lot of emerging evidence, but it's emerging. It is still a very new area. To give an example, in these national surveys that we're running, we're trying to quantify ultra-processed food consumption, and we spend hours each day deciding if I make a stew at home where I'm chopping up my 40 pea carrots and putting, all these fresh veg from, the supermarket in, and then I throw a bouillon cube in it. That actually would be an ultra-processed food. The whole soup, everything in it would count by the strict definition that is used in a lot of the work. And I think most of us here would agree that that's not really fair. So there's a lot of work to be done on just even defining it. And you have to define something in order to study what the impacts are on health. So I think there's something there, but it's a little bit too soon to regulate and kind of make policy on that. And that's the view of SACN and I believe Food Standards Scotland as well, SACN being the Scientific Advisory Committee on Nutrition. So definitely something to consider, but I would say something to consider in the next plan, because I think in 5 years' time we'll know a lot more about ultra-processed foods, about how to define them, and then how to effectively regulate them to promote population health.
Okay. Carol Malkin.
Thank you, Convener. Thanks, Convener. Thank you, Convener. I just want to come back. Is it not one? Oh, it's one now. Sorry. I just want to come back and really understand the power imbalance that people live through in their life, and the fact that people live in poor housing. They often have precarious work. They often have caring responsibilities and high level of health problems in our population. We know that. So as a politician, I really need to understand my responsibility, not just the individual's responsibility in changing this food environment. So I would really like to be clear, is there more work to be done around moving away from the responsibility of an individual to fix this problem and more towards politicians and government taking responsibility? And do we need a wee bit more of that in the plan, and perhaps educating some of us as politicians around how we do that?
To give you a brief example, just as you were speaking, what came to mind is the area of Castlemilk in Glasgow, where people for the last decade have been asking for a supermarket to come into the area and are not able to access fresh fruit and veg where they live. Now, it's a food system issue, it's a dietary health issue, it's a human rights issue also. And so, yes, I think policymakers, politicians have more work to do in actively shaping the food environments, working with businesses to make sure that that food environment is healthier and serves all of us, and where there's gaps in provision, stepping up proactively through things like public diners and other methods to bolster provision where there's gaps. Absolutely.
Brian Whittle.
Thank you. I wasn't going to come in this, but I've got to admit, I'm dismayed at some of the responses I've heard to Patrick Harvey and Sandesh Gohani about the education system. Do you know what? I agree that over the last few decades we've actually lost a lot of knowledge around cooking and understanding of what healthy food is, and I mean, for me, this idea of we need to create our fast food healthier is that the problem is the rise in fast food and the leaving behind batch cooking, for example. We don't do enough of that. It's about promoting health. It's about educating people to make better decisions, which then helps to drive the food environment. We never talk about that, and there's so many good examples of that. I mean, I'm thinking Copenhagen, the model they do out there, where the kids take it in rota to cook the meals in the the schools, they serve the meals in the schools, they sit round a table in a community, and all the food is sourced within 10 kilometres of the school. Surely, to goodness, that's actually where we need to get to. If you don't know how to cook, and you don't have the basics of the cooking, we're never going to solve this problem. So I don't understand this idea of not educating people, because we've lost that over the last few decades.
I mean, I wouldn't be surprised if young people today know more about cooking than their parents or grandparents. I teach a class of 100 undergraduates at University of Edinburgh called Health Eating for People and Planet. You would be shocked by the things they bring in from Instagram and TikTok. They're interacting with so much nutritional information and cooking information. I mean, they can pan-fry tofu way better than I can, and I don't think their grandparents know what tofu is. I mean, it's that generation, I think, is very knowledgeable about this. And so I just, I mean, to go back to what Anna said, we can't keep trying the same thing. It's not working. I definitely agree that what you've described in terms of what's going on in that school is fantastic. And I think that would be great, would help, but I don't think it's the only solution. I definitely agree what you said at the start about, this deluge of fast food, but the solution to that and takeaways on the high street is not educating people that takeaways aren't healthy. I think people know that going to get fish and chips is not healthy for them. So I don't think the solution to these things is education.
Joe Fitzpatrick.
Thanks very much. I think it's actually really refreshing to kind of hear the wide range of views. I appreciate people speaking frankly here, because it's important that we don't have these pillars of what we assume to be fact and not be prepared to change our thinking based on what we're actually seeing in real life. And so one of the things, Lindsay, you mentioned, and I think you commented on as well, was the community diners. And I think I think these are an amazing opportunity for us, because not only do they provide people with potentially healthy, affordable food, they provide a sense of community, so there's often a really important well-being aspect to that as well. So I think that's really good. I hadn't ever thought of it in the sense of this is just really convenient. So I think there's an extra thing that we can do there to push. One of the things, and there's a number of models of these across Scotland. One of the models I like best is where the community have come together, they've got a little piece of land, and so they're effectively growing, cooking and eating together, so really bringing down the cost, the ultra-localism in terms of where the produce is coming from, and affordable. But for me, one of the most important aspects of that is the well-being and mental well-being of the folk who are involved, that huge boost that they get. So how do we maybe encourage more of that in places? So I wonder, Mary, do you want to go first, given I'm kind of extending it a little bit?
Yeah, I think that's a really great point, that if we're going to move away from a culture of convenience, we really need to have something that can replace that. We at the Food Farming and Countryside Commission have been running a project for 2 years with citizens called the Food Conversation, where we've been asking them what they really want from food, really to address these kind of toxic narratives that people just don't care about food, or they only want cheap food, or they don't want government intervention. And we've engaged with 300 citizens across the country, including in Scotland, and consistently we have heard that what they really want is much more connection to food, to where it comes from, opportunities, of course, to grow the food and to get involved in local communities. But really for a chance to connect with each other in those communities. And so I completely agree that something like public diners as a way to get healthy, affordable food that's prepared, that's convenient to people, will not just benefit health, but wider aspects of our health as well.
If you would allow me also to add to that, I think it's important to create a little bit of distinction between the sort of community social project that you've described that are instrumental in creating a better food culture, bringing connection around food, celebrate the food, etc., and sort of public restaurants which are really kind of a robust part of public infrastructure, which are, yes, function as third spaces, which we need more of in a world that is moving increasingly online, but actually are less about kind of socialising and more about provision of good food. And if I think back to my home country, where I've used them all the time, it was from being from a single parent household. Going to these places supplements cooking at home. So if my mum didn't have time to prepare the meal or shop for or even think about, what is it that we're eating tonight, we would just go to our local diner and we would each get a meal. And it was just, I think what is important to say in this, your ability to access a good, healthy, affordable meal should not be conditional on you also having to socialise. I think these two things need to be also separate, and both are valid and have a place.
How do you make sure that sort of public diner doesn't become stigmatised and it's for everyone? Because there's the concern that it wouldn't be.
It's really, I think, the way we think about it is nobody feels stigmatised getting on a bus. Nobody feels stigmatised going to a library. And I think we have a slightly unusual way of thinking about low-cost food, which somehow automatically ties it to food insecurity. It needn't be so. People who access public parks go there not because they don't have gardens, but because they enjoy green spaces. And people who have cars also access buses and trains. So it's about creating a provision that is for everybody on equal terms at low cost for everyone. And then I think that removes the stigma automatically.
Very briefly, please.
Oh, no,
okay. Paul Sweeney.
Thank you, Convener. I just wondered about the design of public procurement in all of this. I know it was mentioned earlier on about the opportunity cost of public procurement in food behaviour and system design. NHS Greater Glasgow and Clyde, for example, my rough calculations spent in 2018 around £24 million a year on food. So, what's the opportunity cost of that? How could we better utilise that expenditure? So, for example, if we have community catering organisations, social enterprises, food pantries, etc., which are already on a shoestring struggling to seek grant funding, surely a social enterprise model would be well served by that vast expenditure being channelled more into a local economy. Just wondered if you have any insights, perhaps. I was just thinking, perhaps, Claire, if you had any potential insights, perhaps, on public procurement design and how that could change.
It's not my area of expertise and how that works. I think obviously it would be best to speak to kind of local areas about how that potentially could work. I mean, obviously you've got to consider things like supply chains. Obviously there's lots of different standards that obviously we have to meet. But I think there's opportunities here, and I think the Good Food Nation, the sort of actors within that allows us to start to look for different opportunities, and so I think it's something that would be welcomed. Certainly, obviously, around the kind of community wealth building bill, and obviously it's a significant anchor institution within Scotland about looking at our NHS. We've got lots of buildings, so there's lots of opportunities there. How we could look at how we can procure more locally and to get more healthy, sustainable food in. It also, therefore, provides a market for new products as well, for so people developing new types of things as well. So I think probably you would get a better response from a local authority about how that might be done, but I think there's opportunities there to look into that.
Much, Convener. I'm going to focus a little bit on school meals and early years nutrition. Now, I know that my colleagues have already ventured into these areas, as usually happens in such discussions, but I'm interested in thinking about breastfeeding. Now, the plan mentions breastfeeding briefly and only in relation to policies that we've already got in place. I'm wondering whether the plan could be a little bit more ambitious in this area about promoting the clear benefits of breastfeeding, where it's possible for that to happen for mother and baby. And if we think about it in terms of prevention for obesity, infection control, promotion of healthy gut bacteria. And I'm also wondering whether that being explicitly mentioned more within the plan might help local areas when they're making their own plan to actually have the Health and Social Care Partnership pay due regard to that, to think about how perhaps they have to fund breastfeeding coordinators and support on the ground for mothers at a time where it can be really difficult to do that. Don't know who maybe wants to answer that, Claire, maybe from a public health perspective.
Yeah, I mean, obviously, in breastfeeding, we would actively promote that. I think there is some mention about it in the plan, but obviously we think to the plans that this will link to in terms of the population health framework, and obviously the population health framework and the new diet and healthy weight implementation plan will have a focus on looking at early years nutrition and child health as well. So I think making sure that we link into the active policies that will support. I mean, one of the things that we are keen to do and put in our consultation response is about having a set of indicators that can be used across different policies. So, for example, if we have indicators to support the population health framework, it would be good to see them reflected within the Good Food Nation plan as well, so that we're actually looking at, when we're monitoring these, a kind of system-wide change to what's happening across Scotland. I think that's also would be beneficial because it prevents a kind of burden of reporting on numerous different things for local authorities, boards, and obviously for government plan as well. So I think in terms of breastfeeding, it could be something strengthened through the population health framework, and obviously then into the Good Food Nation framework as well. It's certainly a really important thing, something we would want to advocate in Scotland.
Okay, and if we stick with that kind of good nutrition in the early years, I know that you spoke about the fact that 2 to 4-year-olds are amongst some of the healthiest that we, at the moment, because we know, I think that, Lindsay, that was yourself about that kind of study looking at them. I want to think a little bit about before that. So we know that those that are eligible will get the Best Start grant, so they'll be able to actually, get nutritious food to help in the very, very early years. If we think about the food environment round about those very early years, it's kind of taken parents away from thinking about what they could do within their household as what the family's regularly eaten to actually, give nutrition to the youngest child. And the food environment out there really is about all of this pre-prepared, pre-packaged food that sometimes isn't as nutritious as what it's made out to be. So there's that element again about how do we ensure that we've got the focus really on that early years nutrition before access to early years education to give kids that, and the family supporting them the best opportunity. I don't know who wants to come in on that.
I can come in briefly to say I think it goes back to regulating the food environment, and I think Lindsay's point about ultra-processed food and looking at that as an area of priority in the next plan feels important. What is also important, I think, in that space is both the kind of evidence base the evidence that came from the monitoring and evaluation of the Best Start grants, which shows really clearly that it really supports parents in trying new foods with kids, even if they're not sure if the child is going to like it. It allows them to take a little bit of risk because it, just gives that extra bit of income. And I think what is also really important in that space is the sort of emerging evidence that came out of a long-term study just last year, which looks at the impact of food insecurity in early years, but also throughout the childhood, on persistent levels of obesity and the 4-time likelihood for young kids who experience food insecurity or notice food insecurity in the household are 4 times more likely to develop persistent obesity than people who don't experience that. So actually this is one of the areas where if we're concerned about obesity, actually bolstering incomes is really important. So policies like the Scottish Child Payment and making sure that that keeps up and increases is really important.
I think that's a very important point that you've just made, Anna, and I've already spoken about this previously myself as a person who experienced severe food insecurity as a child for over a year. I've developed lifelong issues related to that. Yeah. And I think that cannot be overstated. We need to really think about that for young people. So thank you very much for bringing that to our attention. And if we think again about school meals, now we've spoken a lot about that already this morning, and I'm wondering whether should free school meals feature within, as an outcome or an indicator within this plan, or discounted school meals? Now, if I think about my own local authority of East Ayrshire, we were given a report over the summertime that's told us that they've trialled a half-price meal deal for secondary school children. Now, I used to chair the Association of Public Sector Excellence Soft Facilities Management Group, which was devoted to catering, amongst other things, in schools. And that secondary school market was always a real difficulty. And they've actually created a meal deal. Now, I know that sounds like convenience foods to some individuals, but actually that's talking about the food environment those young people are living in. And if they can get a school meal deal for £1.25 versus what is perhaps being offered on the high street locally to them, the uptake has increased, but that's healthy. So I'm wondering if there's an element of how we actually deal with those types of things as indicators in the plan going forward. Lindsay, you're nodding. I don't know if you want to say anything.
Sure, and I was really excited to see that it sounds like that program's going to be continued as well, which is fantastic. So it's great to see those results. I think so. Right now, there are some indicators in the plan around school meal uptake, and I think that they are a great starting point for this. In general, there are very few what we would call process indicators. So how are we kind of achieving these outcomes over time? That they're kind of intermediate kind of things you can monitor that are on the pathway to some of the more outcome-driven things like P1 obesity, for example. And so I think there's definitely scope for it. It's hard in existing data to get at the type of meal, whether it's a free school meal that's been provided or if it's just a school meal in general. So I think additional work would be needed to add that, but it's something that could be looked at in the future, and it's something that we in our living lab are actually very interested in terms of disentangling school meal uptake and looking at how that might shift over throughout the school year and things like that. So, yeah.
Thank you. Does anybody else want to come in? Yeah, Mary?
Yeah, I think just to add very briefly, I think there's also a case then for really clear indicators on the prevalence of fast food outlets and how close those are to schools and what really is available around schools.
Yeah, it's a very difficult thing. Even if you explore planning and how you can actually try and leverage planning into that, it's really difficult to control that environment outside the school. Thank you very much. Convener, thanks.
Brian Whittle.
Thank you. Yeah, no, I think the educational environment for me is actually a key battleground in this. If we look at what we're trying to tackle here, we're trying to tackle poor physical, mental health. We're trying to tackle poor behaviour. We're trying to tackle attainment. We're trying to tackle hunger and malnutrition. It's not out with the bounds of man and woman to come up with a solution to that. And I'm really interested in your opinion around how the Good Food Nation bill could and should address this. If kids are coming to school hungry, should we not be looking at breakfast? And should we not be looking at how we drive that kind of behaviour? And I'm going to link in some sort of activity with that as well. Should the driver come to school to partake in some kind of activity? And by the way, there's breakfast over there. Type scenarios to take that whole stigma thing away from that, because at the end of the day, some of the big drivers, and we're talking about food here, but I find it difficult to separate that away from the need to be physically active, given that a lot of health indicators in later life will be around muscle mass and VO2 max and the like. So what I'm basically saying is the Good Food Nation bill taking advantage of the educational environment to its maximum?
Come in. I think all the opportunities that we have to educate our children and give them good food, we should be utilising that to best of our ability. If we think right from our nurseries now, we have children in nurseries longer. They get a meal as part of the education that they get. We've just updated Setting the Table, which is the nutritional standards for that. They have access to kind of play, etc. within these establishments. We then move on to schools, and again we have opportunities there to give them healthy food as part of that, educate them about where that food comes from, etc. I think the breakfast provision, certainly can be beneficial. It obviously provides opportunities for children to get a good meal, to maybe potentially be physically active. It can also allow for parents to maybe go to work for a good soft start to the day for some children who maybe their houses are more chaotic in the morning. Obviously, if that's an opportunity for schools to be able to deliver that, these obviously appreciate these things come at a cost, but having within our kind of school and education environment, we've got lots of opportunities here to improve health and well-being. So I think we need to take them as best we can. And I think, obviously picking up on the education point earlier, I think, it's great that we have a food culture and we're educating our children about school meals, but I think one of the points is about we need to enable that to happen in an environment where when you go out you need to have the resource and the ability to access good nutritious food. So it all kind of comes as a package. But I do think our education establishments have a role in providing food, healthy food, and the learning around that.
Briefly on the point around food insecurity and hunger and kids coming hungry to school, I think it's important that we see those breakfast clubs as a part of support for parents in terms of, as you kind of mentioned, chaotic mornings, etc. But actually addressing food insecurity needs to happen through cash-first approaches. It needs to happen through bolstering incomes. And children who experience food insecurity, even if we address or try to address that through provisions of breakfast in the morning, you know, kids are often smarter than we give them credit to. They know they live in a household where parents are skipping meals, whether, you know, it's overt or covert. They kind of understand that and the stress that comes through that. And yeah, it just needs to be addressed in a different way, not through a provision of meals, but through bolstering incomes and much more dignified approaches.
Go, Honey.
Thank you. I would just like to very quickly go back to schools. I didn't quite get an opportunity to ask. We spoke about the food environment outside of a school, so let's look at secondary schools, where when I'm walking down the street, I see an awful lot of secondary school children leaving to go to the chip shop to get the special meal deal £1 chips. How are we going to incorporate this into the plan that allows children to have the healthy meal in the school environment?
Comment on this. To address this specific issue, something called takeaway management zones have been implemented, as far as I'm aware, just in England to date. But the National Planning Framework here in Scotland really is a framework that will enable similar things to happen here. And they're really good for preventing or mitigating future takeaways from popping up around schools. And the evidence from England shows that they are very effective for that, in fact. But if your school's already in what we would call a food swamp, which is kind of the opposite of a food desert, so it's a place with loads of really unhealthy, cheap food, then you can't really address that because these types of policies don't address existing takeaways in that area, just the development of new ones. And so I would say that there's not really much. I think the frameworks that Public Health Scotland and Food Standards Scotland have around eating out and working with takeaways to make it healthier is one solution. But the other solution is just to make staying at school feasible in terms of the time that they have, and also desirable for them to consume a meal at school, because we know that school meals are healthy because they meet the standards that have been outlined. So I think there are some different approaches that can be used. And as I said before, I think we shouldn't be looking for a silver bullet or one solution. We should be throwing everything we can at it to, and then monitoring to see what works. I will just put one final plug in on this, and to say that there's also a lot of evidence that weight gain in kids happens not during school time, but when they're out of school. So during a summer holiday period, for example. And that suggests that two things. One, that what we're doing in schools is working, but also that there is a gap in supporting kids to have healthy diets and achieve a healthy weight when they're not in school. So I think some innovations, and that will be addressing the food environment, are really needed.
I'm really glad you said that, because I'm very sorry.
We need to move on.
Sorry.
We are running hugely behind time, and we've still got 7 themes to cover. We might be able to get back to some of what you were going to ask there. Brian Whittle.
Thank you. I mean, one of the things I was interested in is around this One Health approach. I wonder if I could start with a really general question around this. I think my concern here is that, you know, in all of this, there's not really any different definition of what we mean by health. Is that missing from this this document? Okay, I'll expand that a little bit further now. I think, you know, one of the, we're talking very much about healthy food, what healthy food is. And one of the things we're talking about here is going more onto a plant-based diet, or more of a plant-based diet, of which, in general terms, I have no problem with, because I can understand what that means. My worry is here that we are pushing people away from nutrition that we need. For example, around the need, the nutrition we get in meat, hugely important, especially in youngsters, especially in sort of, you know, teenage girls. And are we in danger here of, you know, if you eat too much red meat, it's really bad for you. But I would also advocate if you eat too little red meat, that's bad for you as well. And we've got, you know, and if you're not eating enough red meat, if we start talking about this, we're just pushing people who are not eating enough to eat even less, rather than trying to get the balance of, you know, those that are eating too much need to reduce. Does that make sense?
I think it's quite complicated. That whole area of meat reduction is really complicated. There is really interesting research that came out of the Rabbit Institute that says if you simply ask people to reduce their meat intake, their vegetable intake goes down as well, because people swap what would be a meat and 2 veg meal for a starchy carbohydrate meal, something like a pizza or a baked potato. So I think you're absolutely right to say we need to have a considered approach to that. At the same time, we do know we need, I wouldn't say necessarily plant-based diets exclusively, but we need much more plant-forward diets. We need more fruit and vegetables and whole grains and pulses in our diets for our fibre intake, all sorts of nutrients and minerals that come from that. And there's a real question of how do we enable people to eat more of these types of whole, minimally processed foods. So it's not, it's a slightly more nuanced area, but part of definitely, you've mentioned the One Health approach, so looking at the health of the planet and the transition that we need to do around eating more plant-based diets. There's a general consensus around that, and some countries are moving at a much faster pace on this than we are. We haven't paid any attention in this plan to this really crucial question, and we should be.
Anybody else?
I'm happy to comment on that as well. Just in terms of dietary advice, obviously our dietary advice follows the kind of Scientific Advisory Committee on Nutrition, and that is that we eat towards the Eat Well Guide, which most of you will know, and that also has been checked in terms of sustainability. So, you know, ourselves and Food Standards Scotland kind of work on that. We are updating the Scottish dietary goals, but dietary advice within the plan, as it currently is, would remain the same, which is moving to a diet which would include more plants because we need to eat more whole grains, etc. But currently dietary advice is still around the kind of Eat Well Guide and moving towards that.
I mean, it almost, I'm kind of diverging here, but it almost links into, you know, the back to eating local. You know, it's the way in which meat's produced abroad in certain areas, you know, Far East or US or whatever, is far worse for the planet than the way we produce meat in this country. So there's a lot more nuance to this, and I'm concerned here. You know, as I said, what do we mean by health? Is back to the same question. Do we need to be a wee bit more explanatory in the Good Food Nation bill as to what we mean by increasing a plant-based diet?
Did you want to come in? I think we need to address it. Health is socially constructed, so our understanding of health is quite nuanced, and there's different frameworks that look and define it. I think back to the point of eating local, if we were to eat local, fully local, you know, we don't produce nearly enough fruit and veg and whole grains compared to what we currently eat and want to be eating more of. So actually looking at the production and linking it back a little bit more to the dietary guidelines would serve as well. It would mean producing more pulses, more fruit, more vegetables, and allowing the farm subsidy scheme to really bolster production of those types of food that we need to be eating more of. When at the moment, a lot of our subsidy goes for the production of red meat and the production of crops for alcohol.
Okay.
So this is one of the areas where we're not yet seeing the plan making enough of a joined-up approach between those different outcomes and government departments.
But we're very good at producing root vegetables in this country, but we import most of them.
Yes. I think similarly with seafood, yes, absolutely.
Okay. Thank you.
Thanks very much, Camina. Just a supplementary on this point, this connection between human health, climate, environmental health and animal health and well-being as well. Accepting what you say, that this needs a considered and a nuanced approach to try to achieve what you describe as a more plant-forward diet and perhaps a less meat-intensive agriculture system and diet. We've seen some of, for example, the right-wing press or some politicians react in a very kind of opportunistic, we can't do this, it would be a mass cull of all the animals and it would destroy the, the rural economy kind of approach. But if we make the case that actually this can be done in a way that's beneficial to the rural economy as well, and actually is in keeping with the way many people's diets is gradually changing in that direction anyway, would you agree that public attitudes are more receptive to this than some political attitudes at the moment?
I think Mary can speak to public attitudes due to the work you've done at the Commission, but I think it's maybe final point to make on that is there are parts of Scotland which are only suitable to be used as pasture, and those parts of Scotland should be used as that, but it's about all of the other land and how do we use it.
I'll just add quickly on that yes, in speaking to citizens, they do raise a lot this issue of kind of plant-based or plant-forward, and worry about how that could be co-opted by food industry, or how they promote foods to be healthy, which, with these marketing claims and heavy advertising of them, which are, concealing almost a poor nutritional profile. And so that's what we heard really strongly, that there does need to be a clearer definition almost, with clear regulation around that, so that it's not turned into something that's not beneficial for people.
Sure. Thank you.
Emma Harper.
Thanks, Convener. I said I would come back to ultra-processed foods. And we're here today to look at the Good Food Nation plan. And you've also mentioned the National Population Framework. The Population Health Framework says health-harming products are tobacco, vapes, alcohol and gambling, but doesn't mention ultra-high processed foods. And then the Good Food Nation plan doesn't really mention UHPs either. And I know, Lindsay, you said that there's still investigations around ultra-high processed foods or ultra-processed foods and the health-harming additives that they contain. So I'm thinking about stabilisers, emulsifiers, flavourings, colourings, chemicals, really. And so do you think that the plan needs to take more into account ultra-processed food, or do we need to wait another 5 years for the Scientific Advisory Committee on Nutrition to do more robust research on that?
If I might chime in, and before I answer your question, I might also just thank you for mentioning the health-harming products mentioned in the Population Health Framework, because alcohol is mentioned there, and yet in the Good Food Nation plan, drink continues to be mentioned multiple times, particularly in Outcome 4. But back to the ultra-processed foods. I think the plan does enough for now, and I think the Scottish Dietary Goals are excellent in providing a holistic perspective of what a healthy diet is, and they are being revised, and those revised goals will no doubt be reflected in future plans. So I think the plan actually, as it stands, is currently sufficient, and really I think my major concern around ultra-processed foods actually comes back to something that was mentioned earlier around power in the food system. And I think that that's something that's not often explored. It's not just about the health impacts, or for that matter, the environmental impacts of UPFs, but also the power dynamics there, and how approaching reformulation and things that just keeps the power with multinational companies. So I think there is something to explore there, but I don't think that there's that the plan is lacking in this regard yet. I think that I won't be saying the same thing in 5 years' time, but for now, just because I don't know how to define them appropriately to give advice to people, I don't quite feel comfortable with having regulations and policies there, because it's very hard to define what ultra-processed food is from a scientific standpoint.
And even though I know Carlos Monteiro in Brazil has come up with the NOVA classification, but it's had criticism, it's not quite right. And we've said earlier that sausages, or even putting a stock cube in the soup, makes it processed, but might reduce the salt, for instance. So I know that having the definitions is what we need to work on as well. So I'm wondering also about, I suppose, the links of poverty and austerity, imposed austerity leading to poverty, and then how that is covered in the plan to support better consumption of, and maybe reduction in high fat, sugar, salt, ultra high processed foods.
I'm not sure I entirely understand that second point, so if others want to come in, please do. But I might just note that the HFSS promotions bill that's underway, there was some really interesting work, research done by SRUC on the impact of that on purchases, particularly for low-income households. And they found actually that because of the anticipated shift in the other things that shops will promote instead of HFSS products, it actually had like a multiplier impact in terms of improving the healthfulness of diets for those households, because stores couldn't promote the HFSS products, they promoted other things that met the guidelines, and that actually led to lower expenditure on healthy food. Like, they didn't have to spend as much to purchase healthy food. So there could actually be some unintended positive consequences of that, and it will be really interesting to see that play out first in England as evaluations are going on, and hopefully in Scotland as well. So, but perhaps someone else can comment a bit more on.
I'm happy to take the point around sort of people's incomes and how that relates to the diet. And we know that, pound per calorie, when you're thinking about what kind of food will keep me full for longer, people are, of course, incentivized to buy more ultra-processed, more calorie-dense foods because of simply budgetary constraints, and the cost of a healthy food basket does not match to the levels of income that people have, whether they are in receipt of social security or otherwise. So yes, there is need to be more join up there, and to give credit where credit is absolutely due, I think the Scottish Government is doing really good work on income maximisation, Scottish Child Payment, minimum income guarantee. All of these measures are really important, not just for dignity and right to food, but also for health incomes across a range of issues.
Final little one, very briefly. Just in relation to, the supermarkets, the big companies, there's massive food companies across the globe that are the ones that are determining the system that helps make it really complicated. Does the national plan help support good collaboration with supermarkets, for instance, in order to support healthy consumption?
I think population health framework, where there is some join up around working with retailers, supports that. I think the plan on its own doesn't. I also think it would be really helpful for outcome 4 to specifically talk about the role of food and drink, of food sector really rather than food and drink sector, but in relation to delivering health and sustainability outcomes and not merely in terms of growing the economy. There needs to be more joined up there as well.
Okay, thanks.
Paul Sweeney.
Thank you, Convener. Just also wanted to turn to the mental health aspects of the plan and the implications. Obviously, we've covered the potential social benefits of communal dining. But also wanted to consider time poverty. I know that, Ms Jacobs, you mentioned, you mentioned that the time generally spent in the UK preparing and cooking food is broadly similar to France, for example, but certainly in my experience there's significant disparities in pressure, stress, childcare, and that might create variations within class or within gender-based roles in the community. So just wondered whether, from a public health, mental health perspective, there's any sort of insights on this idea of communal dining or spaces like pantries being developed, cooperatives that might improve those impacts on the community. It's not so much individual behaviour, but it would create these sort of more localised settings, even at a sort of multiple family level, that could potentially improve social well-being and confidence. I just wonder if anyone wanted to have a take on that.
Respond just by way of saying we know anecdotally that that's already true. We know that, for instance, looking at some of the places which offer kind of whole family support or community support, one of the things that people value most is being able to come harvest some food from the community garden, use some of the other produce, batch cook and take some food home, because the burden of cooking, as you said, is kind of unevenly distributed across class and gender in particular. So those types of initiatives are already starting, and I think, yes, supplementing those with a more robust provision is part of it. I think there's also really interesting research currently underway in Dundee looking at all of these types of aspects, so not just incomes, but actually just bandwidth and amount of time that people have to plan, shop for, prepare a meal, etc. So there will be some interesting, I think, evidence to share from that work in the next 2 or 3 years.
That's really helpful. Just maybe to build on that about the role of the third sector in promoting this sort of activity and how precarious the current financing is for so many in the third sector. Could there be better and more robust reference in the plan to the interdependencies with the third sector and how that could drive delivery within community settings? Just again, if there's any potential insights in addition to what's been said already.
I think in our consultation response we have advocated for kind of fair funding models to be built into any of the plan, which obviously a lot of our third sector partners are on very short-term funding models, which makes it difficult to hire staff or make long-term plans or sustainable change as well. So building in kind of fair funding models would enable that to be much more proactive. And obviously these plans are long-term. We aren't going to see a difference overnight, so we need to think about the infrastructure of making that work. And if we want to rely on our third sector, who will inevitably be able to get to people that we won't, and like, for example, in public bodies, I think it's critical that we make sure that we give them the support that it's due to enable that to happen.
Do you think that the mental health impacts of that should be more clearly referenced in the plan? You'd agree with that, with the rest of it?
I mean, I think mental health is obviously within the outcomes, but we would like to see it more filtered through the impact on food, obviously for our well-being, but obviously in terms of how that impacts when you're food insecure, but also on our workforce as well, where if we've got potentially low-paid jobs, things like that, we would like to see that filtered through the plan and look for indicators to see that change as well. And mental health is so important for our well-being, but also obviously within the kind of food environment as well. There's lots of opportunities there to boost our mental well-being.
Professor Jack, just from that public health perspective on mental health and food insecurity, would you have a view that that should be more robustly referenced in the plan?
Yeah, absolutely. I agree with that. I think that it is fair, though, in the plan that they say that there aren't great indicators for capturing this at this point in time. And we study indicators a lot in our Living Lab, and I would agree that there's a lot of work to be done in terms of monitoring that. But in terms of acknowledging it, absolutely. Yeah.
That's great. And maybe just Ms Brown, on a kind of rural setting, farmers, how those kind of communities that grow food and farm to fork, if you like, within Scotland, how that could be more robustly developed through the third sector, with a reference to mental health, well-being, a sense of connection to the wider community, whether that's something you think would be more robustly referenced or should be?
Yeah, absolutely. What I would say as well is that it wouldn't, this kind of reference to mental health wouldn't just be for the people that are accessing the food, but for the people in these community food settings who are working many unpaid hours, are facing burnout, to really make sure that there's much more support for the third sector in general within this plan is really crucial, and it would have benefits across the sector. But without a doubt, something that people across this country care very much about is farmers and how much they're paid, if they're being paid fairly, if they're getting fair returns. If we're talking across a few questions about cheap food, it's cheap on the shelves for a reason, because value at some point has been extracted, and where is that landing? Who is not getting paid fairly across that point, and that ultimately does link back to health and mental health as well. So I think it could be much more explicit.
Thank you.
Thank you. So I just want to finally move on to some of the proposals for monitoring the plan. Obviously, you put a plan in place, we need to know, is it working, what impact is it having? So from your understanding, who's going to be responsible for collating the data, tracking outcomes, sub-outcomes and the indicators that are in the plan?
Yeah, I can chime in. I think it would be useful to have some clarity here if the Food Commission, the role of the Food Commission in terms of monitoring, particularly in terms of the data. And that's true both at the national level and at the authority level. We at the Living Lab are doing a lot of work on monitoring, supporting the monitoring at the local authority and health board level and compiling that data. I think there's also something to be said here for the scope of indicators. I think we all are tempted to measure everything we can and be really comprehensive, but there's a lot of value actually in measuring fewer things really well, and not trying to measure everything, because it's impossible to measure everything, and you lose, to some extent, you can lose the quality and even the interpretation of things if people are just overwhelmed and inundated with numbers. And I think also it's a very quantitative monitoring plan right now, and actually all of these numbers have stories behind them, and that is also really important, that qualitative information about what's actually happening in communities. And so there's, we need to make sure there's scope for also looking at that.
Thank you. I think we are all as politicians quite guilty of demanding more data and more data without necessarily thinking about what we're going to use that data for. Do you think that there should be more reference to the Scottish Food Commission and its purposes and role in monitoring that data within the plan?
Yes, yeah, absolutely. I don't think I have any comment on it. I think it in general, I think much more information about what the Commission will be doing and their interaction with other public bodies, with local authorities, etc., is needed.
Okay, thank you. Did anyone else have anything that they wanted to add there? Of course.
Yeah, I think it's not clear to me, and I will defer to others on the panel, just the capacity that the Commission are going to have to do. And I think, there's a chair, there's 3 commissioners there, but what capacity they'll have, what resource they'll have, and what kind of scrutiny role they would have as well. The ability to kind of, convene investigations and commission research as well as needed. Just from reading the plan anyway, it's not clear to me where that stands.
Just to come in on that as well, I think we would really welcome the Food Commission, and obviously accountability is key for this to kind of move forward and drive it forward. But we would be keen to understand how they're going to work with others to make those recommendations. Where's the evidence base going to be behind that? And obviously within Public Health Scotland, we've sort of committed to supporting that, but it would be good to sort of outline how that will work with us and other stakeholders to enable that to happen.
Can I thank you all for your evidence this morning? I appreciate that we've kept you much longer than we had originally planned, but I think you'll have heard the range and variation of questions from right round the table, how much interest the committee has in this. So thank you for your time this morning, and we will briefly suspend the meeting. Our previous agenda item now by taking further oral evidence on the proposed National Good Food Nation Plan, and a welcome to the committee Mary Goujon, Cabinet Secretary for Rural Affairs, Land Reform and Islands, James Hamilton, lawyer, Tracy McCollin, Head of Good Food Nation Team, Joe Mitchell, Procurement Policy Manager, and James Wilson, Population Health Strategy and Improvement, Scottish Government. And I understand the Cabinet Secretary wishes to make an opening statement.
Well, Convener, in the interest of time, I appreciate the previous session ran over, so I'm happy to just go straight to questions if the committee would prefer that.
Thank you very much, Cabinet Secretary. That would be very much appreciated. So we'll move straight to questions, and Carol Malkin.
Thank you. Thank you very much, and thanks to the panel for being here. And you are right, we had a really robust session beforehand, so it's great to have you here to just build on that. I suppose my question is, it's taken us a while to get here. You probably would acknowledge that. What is the next stage? Do we have a plan that can, action can happen? And I'm particularly interested, as I often am in the Parliament, is how we get that cross-government working, which then can feed down to, sort of right across all the different sectors that we have.
Thank you. And that's where I'm really grateful to the Health Committee for actually undertaking the evidence session and some of the scrutiny in relation to the Good Food Nation plan, because it does touch on so many different areas of policy. I think that's evident from the evidence that the committee has received. I think the number of contributions that were made to the committee, and also I think we saw that during the bill passing through Parliament scrutiny as well. I think just the number of organisations that were involved in that process just shows how many areas food policy touches. So I think that's where I'm really keen that we do continue on that Good Food Nation journey now. In terms of the time that it's taken to get here, we of course passed the Act in 2022. We are talking about a fundamental shift in how we work and how we work across government. So I think it has taken time to make sure that we get the proposed plan as it's been presented in as strong a shape as possible to enable us to build on that. I do think we have really ambitious outcomes that I really hope we do achieve. I think it sets us on a strong footing going forward. Does it address all the issues we know we have right now? No, it won't, and we know that there's more work to do. And I think that we identify that within the proposed plan as it is at the moment, because we know we have data gaps. We know there's more work that needs to be done in certain areas. But again, this is the first plan. We will be building on that for the future. We also undertook extensive consultation in relation to this. Nourish undertook workshops across Scotland to really see what people wanted to see within the plan itself. We really wanted to engage with children and young people. That was a theme that came out strongly through the scrutiny of the bill when that was getting discussed at Committee 2. So I think we had over 1,000 responses from children and young people. So, of course, all of that takes time to analyse and get right. And we published the results to the consultation in September last year. And again, since then, it's been about drafting the proposed plan. I think this period of scrutiny is really important because we obviously want to make sure that we hear people's views on that, and if there are any improvements that we can look to make before we lay the final plan from here. But I think I'm certainly ambitious for the future. It is going to take a lot of work across government to deliver on it, but I really think it's a strong step in the right direction.
Thank you. It's helpful to know. We've been advised there's quite a small government team that's working on it. I suppose my question is that enough, or is it going to build up? And then just very, very lastly, I know time, I'm just interested to know across the UK, is there good working relationships in this? Because obviously the way in which food moves about, it's important that happens, and obviously some of the legislation will be cross-border as well. So I'd really like just a wee bit of information about that possible.
Absolutely. In terms of the Good Food Nation team itself, where there are 5 people within the Good Food Nation team, of course, because the plan is so broad-reaching and it covers so many other policy areas, it could never be up to the Good Food Nation team alone to deliver on all of it. And you'll see we've got colleagues from across government here with me today too, because that's in recognition that it will also be up to other portfolio areas, portfolio ministers as well, to deliver on the outcomes that we have set out in the plan. So there's official level working groups to look at that. As I mentioned, 5 members of the team itself. We also have the Ministerial Working Group on Food to ensure that we're engaging in those discussions across government. In relation to the UK government, I mean, we had already embarked on our work in a Good Food Nation quite a number of years ago, so we were quite well advanced in that. So in terms of collaboration, there hadn't been as much of that with the UK government, but of course they've been developing their own strategies. It's important that the devolved responsibilities are respected within that, and of course we engage in these discussions with our UK counterparts as well. But of course there are areas that are reserved to the UK government that impact on the policies and the outcomes that we're looking to deliver here as well, but we do engage in those conversations.
Thank you. Thanks, Convener.
David Torrance.
Thank you, Convener. Good morning to Cabinet Secretary and to witnesses. Cabinet Secretary, can you explain how a population health framework and a proposed Good Food Nation will ensure improvement in food environment?
I certainly hope they will improve the food environment, because, as I've touched on already, so many different areas of policy are relevant to the work that we're taking forward here. And I think in relation to the population health framework, that really builds on and delivers and really complements the work that we're looking to take forward through the Good Food Nation plan as well. I don't know if there's anything, Jules, you'd want to add, particularly in relation to the population health framework. But of course, between policy officials in health and the Good Food Nation team, there are close links there to make sure that we are delivering on the ambitions, because ultimately it's only by delivering on the ambitions that are set out in the population health framework we will achieve the Good Food Nation outcomes that are set out in the proposed plan. But sorry, Jules, I don't know if there's much more you want to add to that.
No, I think that.
What are your views on the narrative around obesity in the plan? Would you agree with criticism that it places responsibility on individuals, so shifting the focus to them rather than focus on the whole system approach to healthier food?
I would say that we do focus on the food system and the wider food environment, and to be honest, the specific references to that were some of the changes that were made to the plan on the back of the consultation that had taken place in recognition of that. I mean, of course, as individuals, we all make choices, but we need to make that easier for people to make the right choices. We need to make sure we have, as it says in the plan, healthy, nutritious food that is easily accessible to people. So we do need to improve that food environment in relation to some of the restrictions that there can be on advertising. All of these different policies that are being worked on across the piece all help feed into that food system, but we want to make sure we make it as easy as possible for people to make the right choices. We have a good food environment in Scotland and a good food culture here as well.
Around procurement, especially for schools, hospitals, the care sector, where you have children, vulnerable adults, why is this not addressed in the population health framework?
I think procurement is hugely important, and we touch on that in relation to in the Good Food Nation plan. It's referenced there because I do think we have the potential through public procurement to really make so much of an impact, and just as we've talked about there, our wider food system and our wider food environment. In relation to the population health framework, I mean, ultimately that will have to deliver on the outcomes that we see here. In relation to specific references to procurement, even if that doesn't feature within the population health framework, it no doubt will be what the overall health system has to deliver on as well, because that's what we've set out in the Good Food Nation plan, if that makes sense.
No further questions.
Patrick Harvey.
Thanks very much, Convener. Good morning. We had quite an interesting exchange in the last session when I was asking about the role of schools and food education. And I think there was a little bit of a tension between the idea of food education as being a kind of reductive approach to cooking skills and knowledge about what's healthy and unhealthy food, as opposed to the wider role that education settings have. And I think there was some pushback to the idea that the focus should be on cooking skills, and some criticism that the plan places too much emphasis on that. But I think at the same time there was a clear understanding that education settings do have a really important role in shaping attitudes to food and attitudes to how we consume. So I wonder if you could reflect on that balance, first of all, between the slightly narrower, if I can use the word reductive approach to food education, as opposed to the wider responsibility of education settings in relation to food culture.
It's a really interesting issues to get into and discuss, and to be honest, we've been having those discussions ourselves between myself, the Cabinet Secretary for Education, Jenny Gilruth, the Cabinet Secretary for Health, Neil Gray. We actually had a round table on diet and nutrition earlier in the year where we were discussing exactly these issues. I don't think it's a case of, it's one or the other. And again, if people think that the focus isn't quite right in terms of how it's framed in the plan, again, that's where the scrutiny is really important, and we're more than happy to listen to that or to see if there are any changes that necessarily need to be made to it, because I do think having those basic skills are of course important, but I also think we've got a wider opportunity. We do so much work. When I look at my own portfolio, in relation to supporting the work of RET, who do incredible work in terms of getting kids out on farm, understanding where their food comes from. I think we have huge opportunities that we could be doing more with. In relation to wider skills, I think there are so many opportunities and careers in our wider food and drink sector. So are there opportunities that we can build in relation to education settings and exposing young people to that, so we can think of these as realistic careers going forward, where we know we have skills shortages and where we could be doing more. But I mean, I'm really keen to hear the committee's views in relation to some of the evidence that you've heard. Again, I do think we've got the balance quite right. It's not one or the other. I don't think one is going to fix all the issues that we have. It's, as like with most of these issues that I think the committee has been discussing this morning, it's about how we tackle that in the round.
Part of my concern is whether the stated ambition is genuinely going to be delivered. We've already acknowledged that it's 10 years or so, just over 10 years since the first Good Food Nation strategy or document, whatever, I forget the title of it. I was reflecting in the last session that it's nearly 20 years since legislation that was passed that was debating public health and nutrition in schools. And already at that point, some of the schools we visited were going way beyond, and not instead of, but as well as way beyond just better nutritional standards. They were building a relationship with local farmers so that the farmers got a sense of what the schools were that they were supplying to, and the children got a sense of where their food came from. They were going beyond kind of nutritional standards in terms of the environment of the school canteen. Did it feel like a burger joint, or did it feel like something a little bit more down to earth and kind of related to how people eat together? And what is it that young people are learning from that environment? Almost seeing the canteen as an extension of a classroom, not in that it's teaching a curriculum about food, but it's exposing young people to a food system and to a set of cultural expectations. So already by that point, some schools were doing great stuff. A lot of schools were not engaging with that at all. And that's still the case 20 years later. So how can you reassure us that MSPs are not going to be sat around this table in another 10 years saying, you remember that Good Food Nation plan? It set a lot of ambition, but not much has changed.
Well, I certainly hope that won't be the case, and I think with the measures that were passed as part of that legislation, I think that won't be the case, because not only we have set out ambitious outcomes, as I've already said, and I'm not going to sit here and pretend that reaching that is going to be easy, because, as you can see, I think, and no doubt from the committee's own workload, the number of initiatives and strategies that are in place to try and improve our nation's health overall. So there is a lot of work underway. There is a lot of work to be done, and this plan is the first iteration, but I think it sets the building blocks. It is a fundamental change in terms of how we work across government. That takes time to embed, and I think that's where we've really put the focus in the proposed plan as it's been brought forward, because we need to make sure we get that initial cross-government working right, and we need to do that well, which again sets will be an important foundation for how we move forward. But I think also in terms of all the reporting and the review requirements that we have, it's quite clearly set out that the legislation that we have to review the plan every couple of years. We need to look at, are the policies working? If they're not, what action are we going to take? And we also have to remember the role of the Food Commission within all of this as well, which is, we've appointed some members and a chair to the Food Commission, which will have that scrutiny role and be monitoring the work that's being undertaken as well. So I think with the measures that we have in the legislation, the role that the Food Commission will undertake, I think the foundations that we're building just now with that cross-government working, I do believe that we will be in a better position at that point, at a further point in the future.
And you mentioned training and skills and career opportunities, whether they're within food, preparation, whether cooking, whether growing, at a community level or within our agriculture system. We need to do a lot of that to make those kind of careers and opportunities attractive and interesting and exciting. But we also need to think about the current workforce, particularly within the public sector, and trying to get culture change and a change of attitude isn't always easy, and we don't want people to feel that they're just being berated and saying you're doing it all wrong, but we do need to achieve significant change. So how does the government see working with the workforce, particularly in the public sector, where there's a much more direct employer responsibility, to create that sense of a change in food culture being something that the existing staff feel part of that agenda and a sense of ownership with it?
Yeah, that is hugely important, because you're absolutely right. A culture doesn't change overnight, but I think it's how we really bring people on this journey with us. I would like to think that we have undertaken extensive engagement in relation to this, and I would like to think that hopefully that is helping with that. And I would like to think. Can you give
an example of perhaps how catering staff have shaped the plan, how responses, whether from the unions or from other ways, that those voices have been heard in the shaping of the plan?
I mean, some of that I've heard directly myself from some of the engagement that I'd undertaken in preparation for the plan, in addressing catering teams about that, outlining what our vision for a good food nation in Scotland is and the critical role that they have to play in it. And it's not only engagements that I've undertaken, but I know that officials have undertaken that work as well, speaking to people directly, involving them in the conversation, and hopefully they can see how that's helped shape what we've brought forward, and that we have outcomes that everybody feels like they can be a part of and seriously deliver.
Okay, thank you.
Sandesh Gohani.
Thank you. A declaration of interest as a practising NHS GP. With the bill that's before us, or with the Good Food Nation, do you think it's incumbent upon organisations that are government funded, like the NHS, to provide good quality, locally sourced meals?
Oh, I think we all have a duty and a role to play in that. And again, we've set out our proposed plan. Health boards and local authorities, as the relevant authorities named in the legislation, will have to develop their own plans and set out what the outcomes they want to achieve are, but also then how they're delivering on that. So I do think we all have a responsibility and a role to lead by example in terms of some of the changes that we want to see in delivering on these overarching outcomes.
Okay, so what help will be given to, say, venison? Because that's a very healthy way of eating meat. Or what about supply chains like abattoirs? How are we going to ensure that Scottish people get Scottish meat?
You raised two really important points there, and I think particularly on venison, I think one scheme I would want to touch on, that we work with the Soil Association, who provide the Food for Life Served Here scheme, which I think we have 16 local authorities in Scotland signed up to. But one thing that they're doing right now is working closely with Argyll and Bute Council and Wild Jura about getting that supply of venison into the school estate, which I think is really positive and hopefully something that other areas can learn from. And it's not just about schools and local authorities. They've also been looking at the care sector at universities and really branching that approach out to support local supply chains, because I think we know the benefits that come from doing that. But I think it's also important to highlight measures that will be taken forward through the Natural Environment Bill as well, because I think all of that, and we've had extensive discussions and questions in Parliament about community larders for venison too. I think we have this healthy source of protein right on our doorstep, so I think we need to make sure that more people in Scotland have access to it. And in terms of the support for the wider supply chain, again, that's absolutely critical. If we want to have local supply chains, strong supply chains, then we need to make sure that the infrastructure is there for that. We do have the Small Producers Pilot Scheme at the moment, so that when you're looking at the processing, and I think some of the abattoirs, particularly the smaller abattoirs in some of our most rural areas, where our farmers and crofters are really dependent on them, we've provided funding to Dingwall, Mull, the Martin Orkney, to Shetland as well, really trying to better coordinate those services so they're being fully utilised and they are being well supported, because we know that supporting that wider supply chain and the work that goes into that is hugely important, as you've quite rightly highlighted.
I'm going to touch upon the next topic, which is about children. If we look at our kids, 30% are going to be overweight and 17% are obese. And we heard from previous evidence sessions about how you're twice as likely to be obese from a deprived area compared to those of the most well-off. So with a target of halving obesity by 2030, which is the government's ambition, will this Good Food Nation actually achieve that?
Well, certainly with the policies that are being implemented through the wider population health framework, the diet and healthy weight implementation plan that's coming through that as well, I hope that will set us on the trajectory to meet that target. But again, that will be clear in a couple of years' time when we have to report on the policies and how they're delivering on the outcomes that we want to see too. And if the policies aren't working, then we'll also have to look at, well, what else do we need to do? What else do we need to consider to help us meet that target and that ambitious target that we have? So again, I hope that that will help put us in the right direction. We have ambitious outcomes there and targets to achieve. We'll have the initial indicator monitoring framework there that will help us monitor that so that we can set ourselves on the trajectory to do it.
Okay, thank you.
Elena Whittam.
Thanks, Convener. Good morning, Cabinet Secretary, and to your officials. I want to spend a little bit of time and actually focus on school meals, but also early years nutrition. So by early years nutrition, it's those that are in our early years settings, but also right back to the beginning. I would like to first start with breastfeeding. So breastfeeding is mentioned within the plan, but it's really only mentioned in terms of the existing policies that are out there. And I'm wondering if the plan could be a little bit more ambitious in promoting the clear benefits of breastfeeding, where that's possible for the mother and baby to do that in terms of prevention of obesity, infection control, and we know that it promotes healthy gut bacteria. And I'm wondering then if local plans, when they're created, if that could be a driver to ensure that, you know, the support network is there for mothers who are going to be breastfeeding for that really early years intervention and start in life.
Oh, you're absolutely right. That is critical. And I think if the sense is that there isn't enough in relation to that, I think we're more than happy to consider that. And again, that's why the views on this are so important. If it's felt that that could be better reflected. One thing that highlights to me though is that I think the role of the specified functions and specified descriptions that we have set out in the legislation, and the fact that ministers have to have regard to that, I think is really important, because it shows that when we are exercising specific functions and potentially when we're following policy, I mean, this is still to be brought forward in regulation, so the detail isn't here just yet. So if you were to look at breastfeeding, an example of that, if we were developing plans or strategies, we have to have consideration of the Good Food Nation plan and delivery of the outcomes in relation to that, which is how we effectively deliver on what we've set out on the plan and the legislation. But I'm more than happy to consider whether that's something that needs to be more clearly drawn out.
Okay, thanks. We heard from the previous panel about the fact that we know Best Start food and vouchers, etc., have actually shown clear benefits to young people in terms of their very earliest years, and families trying new things that they maybe wouldn't have tried before using those vouchers. And I'm wondering, you know, is there any way that the plan could actually have due regard to this in terms of really focusing on that early years nutrition, because we know that's a really complicated landscape for parents out there to negotiate. And you know that the big companies actually play a real role in what that food environment looks like in terms of pouches and jars for kids, and a lot of people maybe not having the understanding of perhaps what they could cook at home themselves. So I'm wondering how this plan can actually affect change at a really, really early level in young people's lives.
Well, I think it's how the plan is considered in the development of policy in these areas, and how that will help us to reach the outcomes as well. So I don't know if you mean if there's a specific indicator that could potentially be helpful there. I mean, what we have done within the plan is we recognise there are data gaps and that there is some information we don't have to build a clear enough picture of how we can improve from there. But again, some of these gaps we would be hoping to fill, and certainly in time for the next iteration of the plan. But again, I can take that away and look at that and see if there was a particular point you would like to see in relation to that there.
Okay, and in terms of outcomes or indicators, if we think about school meals, should universal school meals be a feature in terms of an indicator or an outcome that's desirable within the plan? Discounted school meals, because we know that that's a really tricky environment as well for families. And I gave an example to the last panel about local to me, East Ayrshire discounting half-price school meals as a trial for secondary school for a £1.25 school meal deal. And that, for the first time, actually saw a drive upwards of uptake of school meals at secondary, which is one of the most trickiest things that we've been trying to grapple with. So I'm wondering, should some of that feature as an outcome or an indicator within the plan?
I mean, it could also feature as part of the outcomes for the local authority plans when those are being developed as well. Because I think free school meal provision is something that we would want to roll out. We don't have the finances to be able to roll that out fully at the moment, which is why it's being rolled out in the phases that have been proposed at the moment. So currently, I think with the indicators that we've got in the plan, we'd be looking at the free school meal uptake in relation to that. But again, it's how that would also work with the local authority plan that would be developed and potential outcomes there. And if there's any extra data that we could gather from that would then help inform the overall national outcomes and indicators, that'd be helpful.
Okay, thanks very much.
Brian Whittle.
Thank you. Good morning, Cabinet Secretary. Good morning to your team. I'm going to meander a bit. But I'm going to start with this idea of One Health approach, and part of the health is already obviously around good nutrition. But can I ask, if we're going for this One Health approach, how do we define health?
Do you mean in relation to the One Health approach that's set out? I mean, I know that came through in some of the evidence that I think it was felt that there wasn't a focus on the One Health approach within the plan, but I think that what we've set out in the plan is aiming to ultimately deliver on what that is, which is about the animal health and welfare, a healthy environment, and our overall health and well-being as well. So I feel that what we've articulated in the plan is probably in the right place, but if there's any particular recommendations you have or suggestions you think that we should be looking at that aren't quite there, then I'm happy to hear that.
I think I mentioned in the last panel my concern is around this narrative around pushing towards a plant-based or more plant-based, which I have no problem with at all. But I think the last panel they almost pushed back on the need for education. But if my worry is that if you're eating too much red meat, then that's not good for you. But also, if you're not eating enough red meat, that's not good for you either. And this idea of pushing this narrative here as towards plant-based, my concern is that those who really do need that kind of nutrition, especially around teenage girls or youngsters, if you're not eating enough red meat, you might even eat even less. So the whole nutritional value of meals go down. So do you think within the plan that's properly articulated?
Again, I'm happy to hear suggestions from the committee if you feel like that's not properly articulated, because I think what we point to is the Eat Well Guide, because I completely appreciate the points that you've raised, and it is about having a healthy, balanced diet. What does that look like? And that's where we point to the Eat Well Guide as what we would reference in relation to that. There's also important work that's FSS have done a lot of work in this area, which highlights that some people are consuming over the red meat intake, whereas younger people in particular aren't getting enough of the nutrients that they need. So again, it's how we promote that healthy, balanced diet that I think we would all want to see.
It kind of brings me to probably my main point around it. My feeling is that the battleground for this really is in the educational environment. What is it we're trying to tackle in there is physical, mental health, behaviour, attainment, hunger, malnutrition, and it strikes me as when we're talking about school meals, as if kids are coming to school hungry, it should be breakfast that we look at. But again, there's this stigma attached to this. Now, I find it difficult to divorce nutrition from physical activity, because I think one drives the other. So when we're talking about this, you know, and you talked about, you know, this idea of working across portfolio, should we be looking at bringing kids in before school? You know, the draw being maybe some kind of activity, and by the way, there's breakfast over there. Is a kind of subtle change in the way in which we deliver that kind of message.
Yeah, it's a really good point, and that's where we've supported. I think it might be extra time, but it'll stand to be corrected if that's wrong, because I think exactly what you've talked about is drawing people into an activity and providing food when they're there. And we provided, I think it's just over £5 million, £5.5 million to support exactly that. And the breakfast clubs is a really important point too. And we've further extended that and provided, I think it's £3 million of funding to extend the reach of breakfast clubs as well, which I think is going to reach about 20,000 more young people too. Of course, universally rolling that, again, just as we were talking about free school meals as well, that does come at a huge financial cost, but that's where by targeting it and rolling it out in the way that we have, whether that's with free school meals, but also with the breakfast clubs and the activity-related food provision, I think is really important, because I do think you're absolutely right in what you've said.
I would say on the around the point about the cost of this, because it is significant. Mm-hmm. Then the cost of physical, mental health, and
absolutely.
And one of the things I think the again, you know, as you appreciate, I've looked at this quite a lot over the years, and what is apparent is that the government intervention, significant government intervention, if they're brave enough to do it, can have a huge impact. I'm thinking of Japan, for example, when they changed their whole structure around school, what you're allowed to eat in school, and what parents were allowed to send their kids to school, you know, with a packed lunch as well as school meals. And they now have an obesity level of 4%. So, and we're not Japan, and we're not Denmark, and we're not, you know, Copenhagen, the one I gave earlier on. But what it does indicate to me is that if there is a will, government can create the environment which allows all the goals and objectives that we all want to attain. So do you think, in this respect, that the Good Food Nation bill, as it currently stands, is creating an environment that gives that equity and that equality of access to that sort of healthy lifestyle?
I think it will help us get there. And I think just coming back to comments that I'd made at the start, will it fix all the problems that we know exist at the moment? In and of itself, it won't. And it depends. I think it sets the foundations for us to be able to do that. And I think that the work that's happening across policy areas is all about us pushing in the same direction to achieve those outcomes that we've set out and to see better health outcomes. You touch on other countries and what happens there. Again, we are looking at other places that have a completely different food culture to our own, and when it comes to changing a food culture, I think that is particularly difficult to do. When you look at the time that people have, I think that's a severe constraint in terms of how we eat together. I think there are so many shifts that need to happen, but I do think that we are in a strong position in terms of the legislation that we have, the plan that we're bringing forward, because I think it builds the right foundations for us to build on and improve in the future, which will hopefully, as I said earlier, help us to reach the ambitious outcomes that we have and that we all want to see. And I think it's about, coming back to the example I think Ellen Whittam raised about what was happening in the secondary school, where we know we have specific issues where, I think FSS have said that as well in some of the work that they've done, that, the health of primary school children is better than those at secondary. So how do we take those good examples that we have and build on that, share that good practice, and ensure that that's more widespread than just a one-off example? And that's really what this is about.
Just finally, if I could, I made this point earlier on, is the environment in which we currently sit just now, in a lot of ways, especially in the public sector, it's not conducive to health. We're building hospitals without kitchens. We're driving the food up the M6 from Wales to those hospitals and throwing most of it out. So how is the Good Food Nation bill going to address that? I mean, we have to address that kind of issue.
Oh, you're absolutely right, and I think the food waste point is so important, and it's so huge when you look at the levels of food waste that we have. And all of this was raised through the Agriculture and Rural Communities Scotland Act as well. But I think this again just highlights the importance of work that's happening across government when we look at a circular economy. Now, I would hope. Now, I know that in some areas they have centralised their units, they've removed kitchens. We've seen other areas that, are doing the complete opposite. And again, it's about building on that good practice. Ultimately, it's going to be up to health boards and local authorities to set out how they are going to be achieving the outcomes, how they're going to monitor that, how they're going to implement that to help us reach the overall, how they're going to match the principles that have been set out in the legislation quite clearly, but there is a strong role that they will have to set that out, consult on and make sure that there is that wider buy-in to the approach that we've taken, because I think what you've outlined, ideally that isn't what we want to see. You would prefer to see kitchens on site, whether that's in hospitals, whether that's in schools, fresh. You want short local supply chains. I think we probably have a shared vision of where we would like to be in relation to that, and for me it's about ultimately how we can deliver on those ambitions, and I believe with the proposed plan that we have, future iterations of that will hopefully help us deliver that, as well as the plans of health boards and local authorities.
Okay.
Thank you, Convener. Just going back a wee bit, I wanted to come in with a supplementary on the One Health issue that was raised a few minutes ago. There's, broadly speaking, the idea that we can achieve coherence between human health, climate and sustainability, and animal health and well-being, and that a less meat-intensive agriculture system, as well as a less meat-intensive diet, is seen as a positive route to achieving all three of these things. And I think what we heard from the last panel was a call for a balanced and a nuanced understanding of these issues, and a rejection of the idea that there's some kind of extreme demand for mass culls of animals, or that it's going to destroy the rural economy, or indeed the idea that there's no such thing as a healthy vegetarian or plant-based diet, because of course there is. I wonder how you can convince us that the government is embracing this balanced and considered approach to uniting these agendas, when it has explicitly rejected the advice of the UK Climate Change Committee on agriculture and land use, basically because the government doesn't want to start talking about less meat production.
Well, first of all, touching on the recommendations and where we were the carbon budgets, I think what had been recommended by the Climate Change Committee would have had a drastic and very negative impact on rural and island communities across Scotland. And I believe that we can still lower our emissions and do that in a way that means working with our farmers and crofters, and in a way that still supports our rural communities and the wider supply chain and industries and people that depend on them as well. Which is why that was set out. So yes, every sector in society has to lower its emissions. We believe we can do that in a different way, because our livestock industry and our red meat sector is so important, not just for our health but for our wider economy, particularly in our rural island areas. So I think it's important that we continue to support these sectors, support these livelihoods. But of course I don't see any conflict with that and the dietary advice that we have, that pretty much essentially says that we need to consume more fruit and veg. We know that we need to do that, and comes back to the point I made to Brian Whittle. It's about how we get the balance. We have the Eat Well guide and the recommendations there, and that's what we hope to achieve, because that's what sets out what a healthy, balanced diet should look like. And if anything, I'd want us to see us eating more of what we produce in Scotland. And I think the work through the Agricultural Reform Programme, what we're doing with the Good Food Nation, is really about doing that. And also a really important point to mention too, that I don't think we can forget, is fish and seafood. Look at what we produce. We export so much of it. Seafood Scotland do so much good work now in terms of, which we're trying to support them with, getting fish into schools, people understanding more about what we produce in Scotland, in our waters, getting people to understand so that they will then choose that, and they're exposed to it from an early age, which I think is so important. So I just want to make sure we don't forget that element in things.
Just so that I understand the government's position, though, the government is saying we want a less meat-intensive diet, we want a balanced approach to achieving that, a more not wholly plant-based, but a more, as was described in the last session, a plant-forward diet. We want emissions reductions, but that can be achieved without any reduction in meat production in Scotland.
Yes, I believe we have an alternative way to do it, and that's what we've set out in relation to the carbon budgets.
Okay.
Emma Harper.
Thanks, Convener. Good morning, CABSEC, and good morning to your officials. Before I ask my questions about ultra-processed food, I'm interested in the language in the foreword of the National Plan that basically says, at the very bottom of page 2, without the full powers of independence, we do not have the complete control of all the levers of food policy. I would be interested to hear about the powers that we don't have, and is that related to the impact of the Internal Market Act and our ability to, lever supermarkets or cross-border trading, or what do we need in order to basically have all the levers to deliver a plan?
Well, there are a number of different areas there that touch on it both directly and indirectly. You touched on the Internal Market Act. I think initial concerns with that were about the potential for the Internal Market Act to constrain how we could develop policy going forward, given the very different nature of our landscape and our farming systems in Scotland, and given the direction of travel that was being taken in England, and the potential for impacts there, which we could well see. Obviously, trade, we don't have responsibility for that, which impacts the flow of food in and out. And we've seen some of the trade deals that we've been signed up to, which could have an adverse impact on our agricultural sector and our producers here in Scotland. But again, the plan touches on so many different areas of policy where that's also relevant. I mean, the cost of living crisis, the amount of money that people actually have, and we know about deprivation and the links to poor health outcomes. So again, we don't have all the levers in relation to that. We obviously bring forward our own initiatives to try and act within the powers and the budgets that we do have. But of course, without all these levers, we won't be able to say absolutely that we can necessarily fix all those problems. So I think it's just important to set that out.
Okay, thanks for that clarification. I am interested in ultra-processed foods and research that is emerging that says it's not good for you, and in the national framework, the population health framework, health-harming products are listed as tobacco, gambling, and not, whereas my notes, tobacco, vapes, alcohol and gambling, but ultra-high processed foods are not listed. Is that because we're too early in the research to pin UHPs as a problem and health-harming products?
I completely understand the concerns around this, and I think this has been a matter that's been raised directly with us and has come through the evidence the committee has received as well. But I think, as I understand it, there are some issues around, I think, some of the evidence gaps around that. I believe that the Scientific Advisory Council on Nutrition is going to be undertaking another review next year, as far as I understand, in relation to that. I think it's because of some of the definitions and some of the classifications too that ultra-processed foods could capture, well, it doesn't differentiate between, whether that's white bread, wholemeal bread. It doesn't really account for, how you cater for people with allergens or who are looking for other alternative food products, which are then more processed. So I think there's issues with the classification and the evidence as far as I understand it, which we would, but again, it may not be in this iteration of the plan specifically, but that doesn't mean that it wouldn't then feature, once that evidence becomes available in future iterations of the plan.
Okay, thanks. And I'm interested also regarding the tension between localised food availability, food processing, the role of major supermarket chains, and what role the national plan plays in addressing some of the tension between the big producers, global producers, the whole supply chain. How is the National Food Plan going to help address some of the tensions that we see?
I think, well, hopefully with the outcomes that we've seen there, the policies that are outlined that are currently where we're taking action in relation to that. I think it's also important that, of course, I think we've referenced that in the plan when we look at all the different types of initiatives that are currently happening across Scotland, and it comes back to the point about wider good practice that we see, how we really embed that, develop it and help encourage it. Community supported agriculture, when we look at allotments, community growing, some of the local initiatives that are happening in communities, we really want to encourage that and enable that as much as possible so that we are getting those, again, small local supply chains. And I think it's, I see examples in my job all the time, particularly in relation to community right to buy, visiting projects in city centres, for example, where groups have taken on ownership of areas of ground within a city which are supplying the local community. It's not just about the food supply, but it's also about the wider community engagement. I think, the cookery classes, I think that wider community cohesion point that comes off the back of all of this. But of course, we do have our bigger suppliers in Scotland and our bigger producers, which of course are also important. So for me, it's not about big versus small. It's about how we are able to really develop, ensure that we are encouraging small producers, and a lot of that will come back to agricultural reform and what we're doing, and also looking at the land reform bill, how are we creating more opportunities for people to own and access land, help new entrants and the next generation of farmers come into that as well. And then I think with the work that's being done through public procurement that can be driven through local authority plans, through health board plans, we're really helping to build and sustain those strong local supply chains.
Okay, thanks. Just a wee final question. Tomorrow, Rural Committee is having a round table about the Good Food Nation plan as well. Local government committees doing it as well at the same time today. And I'm keen to hear about how do we reassure the farmers, because without farmers we won't have any food. So how do we reassure the farmers in Scotland, which you've just intimated, small farmers, big producers, how do we assure them that they will absolutely be considered when we are looking at future iterations, but the current plan?
Absolutely. I think that's fundamental to the whole plan going forward. I mean, we are talking about food. It needs somebody to make it, to produce it. When we look at our farmers and our fishermen, that's what this all hinges on. And ultimately, we want to support our primary producers to ensure that we have that food supply, which then helps sustain these local supply chains. So they are the absolute linchpin of what we're doing in policy development as we go forward.
Okay, thanks. Thanks, Convener.
We touched on it earlier on about this sort of equity of access. There's this idea that a bunch of bananas cost the same as a Mars bar, but that only works if you've got access to that choice. So how do we create? How will this bill create that that sort of environment where people have choice? Because I think for me, government's about creating the environment where choice can be made. So how are we going to do that?
Well, it's about improving that overall food environment. I mean, this is through the plan, I think feeds into the outcomes, but when we look at some of the initiatives that we already have underway, our Go Local programme, which is about supporting smaller convenience stores, and it's about having access to local products, but also those healthier products as well, and helping support people to make the right choices in that respect. I mean, there's work that will be taken forward through the Population Health Strategy, the Diet and Healthy Weight Implementation Plan, and again, some of the other areas that we've talked about as well, which I think will all help contribute to creating that better food environment that we want to see.
So you sort of touched on a wee bit there, kind of the smaller food producers and their access to the market, which has been, to be fair, has been a criticism for some time. It's sort of through the sort of the procurement chain. So how does the Good Food Nation bill feed into that, giving our food producers that access to our local stores, and give them that access to market?
Well, there's work, you'll be aware, and I know that we've had this discussion a number of times in Chamber in relation to public procurement, really, and how we can better support local producers through that. Now, procurement was a theme that came through strongly in all the evidence that we heard in relation to the Act itself, and which we highlight within the plan. But there are a number of pieces of work. Obviously, we have to make sure we're working within international regulations, within our own domestic regulations, but it's really about how we can work within those regulations to really ensure that we're helping those SMEs and smaller producers to access some of those opportunities that are available. So I might turn to Jo in a minute, who might be able to say a bit more about that. But I mean, there are a number of initiatives there where we try to do that, and where we have seen a positive trajectory in terms of the number of small and medium enterprises who are now getting contracts that are available, and also the amount of spend that's going there. But there's also the supplier development programme and other initiatives to work with those businesses to make sure that they're in a place where they feel like they can bid for some of the opportunities that are available, as well as highlighting what can be done within procurement to break things down into smaller lots, to geographic areas as well, to make it easier for some of those smaller producers to access. But Jo, I don't know if there's anything else you'd want to add on the back of that.
Just maybe mention the engagement, because obviously we have quite set governance structure of procurement in Scotland, so we speak to everybody that's involved in public procurement in Scotland, and we've involved both Scotland Food and Drink and the Soil Association in that sort of, so the providers can give a view and suppliers can give a view on what we could do more. So I think that's quite important.
Just finally on that, it's actually to Patrick Harvey's point around the how we develop, how this plan will develop and support diversity in farming. So as it currently stands in Scotland, obviously we are quite a sort of dairy meat producing country, but we're also very good at things like root vegetables and what, but we import so much of that rather than produce our own. There must be a way in which this plan engages with the farming community to encourage that diversity and make it worth their while to develop those kind of products.
I think it touches back to some of the points that Emma Harper was making in relation to that as well. And when we are considering our support system, obviously we're working through our agricultural reform programme, what the future support system is going to look like, and what support we're going to provide. So, of course, Good Food Nation and the outcomes that we have set out in the plan here are all going to feature as part of that, and you'll see agriculture is quite heavily referenced in the plan as it stands at the moment too, because again we all want to be in that place where people have access to that high quality, healthy, nutritious food. That's what we talked about through the passage of the Agriculture and Rural Communities Scotland Act as well, and the importance of that. So again, that's where it all ties together.
Thank you.
Helena Whittam.
Thanks very much, Convener. I want to spend a little bit of time and actually think about the food industry itself, but I'm also going to come back to procurement. In our call for views, the food and drink industry has responded, and they're clearly engaged in the creation of a good food nation. But how can the plan ensure that their involvement in the development of a good food nation is suitably balanced against the public health policy objectives in ensuring the prevention of ill health, malnutrition, alcohol harm and obesity? So we know a lot of the time we talk about the food and the drink industry. Where is the space for the drink industry in this if we're thinking about actually prevention of harm and a good food nation plan? So I'm just wondering, how do we balance out the very strong and vocal voices of some of those big actors in the space versus that public health approach?
Mm-hmm. Well, that's where I'm interested. First of all, I mean, obviously it sets out in the Act itself that we have to give consideration to the views of the food industry. But I would like to think that, I mean, from my perspective, hearing all of these voices is really important, and the sheer variety of stakeholders who have input their views to the consultation, who've submitted evidence to the committee, all of that is equally as important to me. And I think it's making sure that none of those voices feel that they're drowned out, and that everybody feels like they've they've got a plan that they feel like they can get behind. I understand that there's criticism, or people might feel that there's more that should be in there that we haven't got quite right this time. And again, this is the first plan, but it's really important for me that we have that balance. So I'd be interested from the views of the committee if you feel that isn't quite right, or if there's more that needs to be considered in relation to that.
I guess the concern that we're hearing from stakeholders would be perhaps that some of the kind of big tobacco tactics are being used in terms of some of the food industry, in terms of perhaps the plan as it's set out. So I would just be concerned that you feel as if you've got the balance right and everything that you're hearing, and how you're going to treat all of that, all those competing demands that are coming from different parts of the sector.
I certainly feel that we have, but again, I'm happy to reflect on the plan if it feels like that balance isn't quite right. Because I think that's the important part of my job. It's not just engaging with one actor or another. It's about making sure you are hearing that spectrum of views, and that this is as representative as possible. I don't know if there's anything from a health perspective you would want to add in relation to that, Jules, because to me I think we are taking forward really important work in relation to the population health framework, the work that will be done through the Diet and Healthy Weight Plan, and on alcohol. There's strong action being taken there, so I don't see there being any particularly overt influence that has affected the plan as it stands. But I don't know in terms of the engagement if there's anything you want to add.
In terms of the population health framework, we have engaged with a wide range of stakeholders, and then with the Diet and Healthy Weight implementation plan, we will be engaging with public health stakeholders, but also with the food industry, and it's to make sure that that balance is there. But also the primary goal with the population health framework is to make a healthier Scotland, and that will be the kind of prime drive of the work that we're doing. And then obviously with the tobacco, we've obviously got Article 5.3, and the engagement then happens on implementation because of what the article states.
Yeah, thank you. That's helpful from both of you. The other question that I wanted to raise was around about public procurement. So some of my colleagues have already touched on that today. And we know that this is an important thing, if we're thinking about our local suppliers, our local food producers. And the plan outlines how existing legislation has been put in place for more than 10 years now. And, this has been quite successful. We've seen where it's been quite successful. There's been a lot of kind of breaking up of the traditional procurement rules and regulations that we thought we could never change. So I've seen this happen in East Ayrshire, where I was previously deputy leader, and working with the Soil Association in terms of good food served here. Now, my concern is about how we don't start to undo that good work. And my worry is that when procurement rules are applied stringently, we could see contracts that were previously awarded to local suppliers suddenly not being awarded to those local suppliers anymore. Now, I'm not seeking to influence any procurement decisions that have been taken, but I'm just wondering whether the government's alive to the fact that good work that has been in train, that has been used to change procurement, now might seem to be on shaky ground a little bit.
Yes, I think we are very much alive to that, and I think concerned about some issues that have happened and that we've seen particularly recently in relation to that. And I think that especially where people have lost contracts that they've had, the ability was there and they were able to be awarded in the first place. So I think that we are able to, I think through the work that we do in public procurement, there is the ability there to help those local suppliers and those local producers as it stands at the moment. And I hope that is where, when we have finalised our national plan, that the work that local authorities will take forward, that health boards will take forward, that will be a strong focus within that, so that we see things continue on in, I think, the direction that we would all want to see, where we see these strong, local, resilient supply chains.
Yeah, because would the concern not be that where you have an organisation such as a local authority, one of these anchor institutions who is doing all that good work, you would hope that in future then it would be the Health and Social Care Partnership as an anchor institution from that area would then start to look at care home settings and how they would use local food there. The NHS locally would start to do the same thing. I mean, if we see that receding, then that becomes a slight concern. So your view is that this plan and then the local plans really should help drive that forward?
Yes, absolutely. That would be my hope from that, because I think we do have so many strong examples across Scotland of good work happening. And we really want to build on that, not to see that recede or go in the opposite direction. And I think that's where I'm really keen that this heads.
Thank you.
Paul Sweeney.
Thank you, Convener. Just wanted to turn to the mental health implications on the bill, particularly the idea of time poverty as well as financial poverty. We know there are significant class and gender-based variations in food and nutrition and the role in preparing food in the community. And there's been a proposal around public diners and more communal dining spaces. Just wondered what the Minister's view was on the potential for that to be rolled out in a more systemic way in Scotland.
Well, I think it's really exciting. I think some of the plans that are being talked about at the moment in relation to public diners and the wider impact that can have. And again, that's exactly, I think that looks to deliver on the outcomes that we've set out in the plan, and really interested to see how that goes, and hopefully we can build on and help support the rollout of some of those initiatives. I mean, you talked about the mental health element there. That is one area of the plan where I think that we've identified, just as with some other areas as well, where either we don't have enough data or where we need to collect more data just to be able to look at whether that's potential indicators we need to develop or to see how we can monitor that going forward. But that is a really important element that we need to look at. But some of that we have picked up and touched on in the plan as areas where we need to do more work.
Mm-hmm. I just wondered what the Minister might envisage seeing that play out. So, you know, we talked about procurement and the opportunity cost of using public expenditure and the demand signal from public expenditure to sustain projects in the community. So we know there's a kind of absurdity in the system currently where we've got lots of third sector organisations that are chasing ever diminishing grant funding. There's a stress within those organisations. But we have vast contractual value flowing through the system that is perhaps bypassing our communities, that if that pound was working harder in a local setting, it could actually achieve multiple effects, including stability of local community projects while supplying services and actually developing more of a cooperative or social enterprise model that could really be, you know, a virtuous cycle. So just, I mean, certainly that's the kind of discussion that's emerged during the sessions today. I just wondered if the Minister had any reflections on that and providing that sort of underpinning for a community, that we're removing the stress of the organisations, the burnout that's often experienced. I know certainly we often get communities, charities that are chasing grant funding and they're stressed out about it. We know that the service users are worried about their future. They maybe have a connection with organisations. We know there's this disparity between health boards, local authorities and health and social care partnerships, and turning on off and on projects that seem to militate against national objectives. So just wondered whether the Minister thinks there could be more coherence in that whole process that could provide greater security all round.
Oh, I certainly hope so, and I hope that's what the development between the proposed national plan and also with the local plans will really help deliver that, because I think that when you look at the overall value of public procurement, when we're looking at food and catering services, I think it's about £220 million. So when you think about how that's targeted, the potential impact that that can have on local communities, supply chains, I think it could be really powerful. So again, that's what we would hope to see emerge through some of the other plans that are being developed. Obviously, there is an element of flexibility there for health boards and local authorities to develop the outcomes. I think it's important that there is some flexibility across Scotland so that each area can develop outcomes that reflect their own specific needs within that area. But I do think that the legislation that we have kind of will underpin those plans, and I think sets out the overall approach that will need to be taken. And of course, my officials will be working closely with health boards, with local authorities in the development of those plans as well.
Okay. Do you think that the plan could more explicitly reference the idea of communal dining as being a social good in the plan, and also perhaps, I know it was touched on by colleagues about procurement, there's been a preoccupation with cost and quality in procurement traditionally. Perhaps social value and how we measure social value could be more defined as well. You know, these ideas about, well, it's reducing loneliness, it's improving, you know, the time wasted in applying for myriad funds, etc. There's other ways we could measure that, and it could demonstrate better value for the community as a whole.
I think just in relation to your first point, and whether the plan should capture more of the community dining element, I mean, if you think that's something that needs better reflected in the plan, again, we're more than happy to look at that and see if that's something that can be drawn out. I think the only problem with the plans is, as it's gone through various iterations and been out to consultation, things are ever evolving and there are new initiatives, and I think we always run the risk of it will miss something, it might not capture everything, but again, we have that important reporting to do every 2 years and then review of the plan after 5 as well, which hopefully would give us the chance to capture that. And sorry, just in relation to your second point, was social value in relation to public procurement and how we could capture that?
It demonstrates mental health outcomes that are beneficial. There's a public health benefit. How do you capture that opportunity of social value creation within, say, procurement, so that it can drive behaviour in commissioning and procuring services? And
Right, okay, because I would say that I think through various iterations that have come since the Procurement Act in 2014, I think there have been further regulations and guidance from that which are about really embedding some of those values within it, but I'll turn to Jo. I don't know if there's more that you want to add to that.
So, as you probably appreciate, we do take a slightly different approach to other parts of the UK with the Procurement Reform Act from 2014, which includes the Sustainable Procurement Duty. We're really keen to give people sort of local ownership and people to use their judgment in this. So on one hand, we do provide a lot of guidance and we provide a lot of training and support both to the procurement community to understand the flexibility and the opportunities in procurement, and also to the supply community. But we do actually have some measurement through the Act. So we have people have to set out how they're going to our public bodies have to set out how they're going to comply with the Sustainable Procurement Duty in their strategy, and they have to report on those strategies annually. And then we sort of do some analysis on that. So this is the approach we've taken, and we appreciate other parts of the UK are looking at set social value metrics, but actually we think giving people flexibility and appreciating that they have judgment and they understand their local environment better. And there are a number of ways that you can approach this. So you can actually specify, particular schemes of provenance. In the case of food, you can actually demand payment of at least the real living wage to providers, and they don't have to be scored, or else you can actually allocate a score depending on what's appropriate in a particular case.
Is the risk, though, that by having that you're introducing inequality by differential judgments about what constitutes value? Because I'm imagining what I've often seen in local authorities is massive risk aversion, particularly around budgets. So there's very little appetite to be experimental.
So we have taken a very consistent. Okay. Oh yeah. So we have taken a very consistent approach. So we have set out the Sustainable Procurement Duty. We have underpinning statutory guidance. We have very extensive practical guidance, and we provide ongoing training to public bodies across Scotland in this. So while they have local discretion, we have tried to drive a consistent approach, both in terms of what they might do in the procurement process, understanding the strategic nature of procurement, and then sort of try and follow that up through the monitoring and reporting process.
Okay, thanks.
Jo Fitzpatrick.
Thanks, Convener. Thanks, Cabinet Secretary. You mentioned, a few times about the requirement for local plans. And obviously the Act will require health boards and local authorities to prepare their own good food nation plans. Obviously that part of the Act isn't yet commenced, so it would be good to hear your thoughts on when that will be happening and just how that's going actually just now in terms of health boards and local authorities preparing those local plans.
Well, I think in relation to that, obviously the team's focus at the moment has been largely on producing the National Good Food Nation Plan. But of course through that work it's been really helpful and informative in terms of the amount of work that needs to be done in development of the plan and how long that then might take and the resources that might be needed for that within local authorities and health boards. So from the point that we commence Section 10 of the Act, which means that local authorities and health boards have to produce their plans, there's 12 months from that point for that plan development. So I think we obviously want to commence that at a time when we know that local authorities and health boards feel comfortable with that time frame, and those discussions are very much ongoing between officials and local authorities as to when the most appropriate time for the commencement of that section of the Act might be, because we do want to make sure that they have the time and they have the resources in place to be able to deliver on that, but that's ongoing. And in terms of the plans themselves, there has been guidance that's been produced to really set out the legislative expectations that will be there that local authorities and health boards will have to meet, but that dialogue is very much ongoing.
So are you confident that local authorities and health boards are taking the steps to prepare for when you say, right, that's it, started, you've got 12 months? Is there work going on? Is there a degree of confidence? I see Tracy nodding.
Yeah, that's how, well, Tracy's leading on this work, so Tracy, if you want to say more.
I think it's true to say that local authorities and health boards are probably all at different stages, but the work that we've done within the Good for Nation team is to identify a lead contact in each of those organisations, and we've had good success with that. And that has been really helpful in that at key points in our process, we're sending information to those contacts. They are then disseminating it within their organisation, and that has created questions. We realised that there was a need for some guidance which has been published. We held a workshop where we went through the legislative authorities and set out what might be needed to happen in terms of preparing a plan, and gave an opportunity for questions to be asked. I think because there's a difference in, some local authorities already have food plans and they can use that as the basis of becoming a Good Food Nation plan. Others are starting right from the very beginning. So as the Cabinet Secretary said, we've been focusing on getting the national plan ready, but looking ahead, we are thinking of ways in which we could provide further support to local authorities and health boards, and what would be of most use to them, because we don't want to be imposing something that isn't helpful. So I would say we've started those conversations. We've identified the people to keep in touch with and to ensure that the information is getting to the correct people. I would imagine that health boards and local authorities, particularly if they're more advanced with this work, are probably getting a little impatient about when Section 10 will start and will be commenced. But we are getting advice from local authorities and health boards as well as to how long they think they will need to undertake their plans, and in terms of what support they may need in terms of a timing and resource. So the work is in the initial stages, but it's certainly begun, and we're getting good engagement from those lead contacts.
Thanks very much. And in terms of that engagement, obviously there's no point having local plans if they're just a carbon copy of the national plan, so there has to be a difference, but clearly it's important that the local plan doesn't go counter to the national plan and they can work together. From the initial discussions, does it feel that that's happening and that's going to be possible?
I would say writing a Good Food Nation plan is a daunting task, and I think that would be at the stage where most people in those organisations, that's what they're feeling at the moment. So what the guidance is setting out is that the Good Food Nation Act is actually quite prescriptive in what the plans have to have regard to. So that's a very good starting point. And obviously the national plan will be published because they have to have regard to that as well. So that will provide some steer, and it's sort of the thread that works through all the plans. So I think the plans will look quite different, but there will be these common themes running right through them. But as I said, it's a daunting task for the first ones. So.
Okay, thank you.
So, Cabinet Secretary, I'm assuming that you listened into at least part of the previous evidence session, and I raised the question right at the very end about the data collection. Obviously, you're going to want to be monitoring how effective the plan is and what impact that's having. You would have heard some of the concerns that the witnesses had about the capacity of the SFC to scrutinise the plan, the scope of the indicators, that it was very focused on quantitative monitoring, whereas there was there would be a lot of narrative potentially could get lost. So I just wondered what your response was to that and how you could address those concerns.
I recognise that there are concerns around that. First of all, I would just want to set out that there is going to be further publication that we're waiting for from our analytical colleagues that will, I think, provide more information around the indicators and that framework. So I'm happy to send that on to the committee when we have that available too. Of course, we will be monitoring closely we have the indicators set out there, which will help form the baseline of that monitoring framework that we'll establish. In terms of the capacity of the Food Commission, it's not fully up and running yet. We're still in the middle. We have 3 members of the Commission and a chair. I think we're in the midst of the appointment of a chief executive for that as well, and there will be a wider team to support the work of the Commission. So I don't think it's necessarily fair to write it off just yet in terms of the capacity that it will have. But it also has an absolutely critical role, which is set out in the legislation and in terms of the advice that they'll be able to offer to ministers. And I think the review periods that we have set out, the scrutiny role that they will have, I think means that we will very strongly be held to account in terms of the policies that we've set out to reach the outcomes. And of course we have to set out as part of that as well, if the policies aren't working or we're not reaching those outcomes, then what needs to change and what other pieces of work are we going to do. I think we have been quite transparent about the fact this isn't the perfect monitoring framework. We have data gaps, we have areas that we know are missing, but that's what we have highlighted and areas that we will continue to work on. For example, we've asked the Scottish Animal Welfare Commission to do some work on us in relation to animal health and welfare. What might more targets or indicators for that look like? Because in setting any new information, we need to make sure we can collect the data to enable us to monitor it. So that is very much a work in progress, but I think we've been quite transparent in terms of the work that needs to be done. But I do think we will be held to account, and that monitoring will all be transparent.
Thank you very much. Cabinet Secretary, can I thank you and your officials for your attendance today. At next week's meeting, we'll commence taking oral evidence as part of the committee's pre-budget scrutiny for 2026 to 27, and that concludes the public part of our meeting today.
Thank you.